Good evening, everybody.
पवन जी
नमस्कार. Sorry, मैं live कर रहा था program को. I am sorry. I would like to welcome you all on World Cancer Day.
Thank you.
I am confident that with your blessings, cooperation, and support, as this journey has reached today to a great milestone of 303rd century, thank you all. Really, I would like to communicate thanks to you all. You are my guide, guru, mentor, philosopher, and showing me a path. I would like to welcome you. Really, I am blessed and overwhelmed by this blessing and kindness to accept our invitation within short notices. IRE विष्णु प्रसाद शर्मा जी को प्रणाम.
Pranam, Doctor, Pranam.
So right from all continents, this was our dream, and now this dream is being fulfilled on today, 300th webinar. Today we will be discussing on cancer. We have Siddha experts, our Guru, Dr. P. Jayaprakash Narayanan ji, Professor Dr. R.S. Ramaswamy ji. From Ayurveda, we have our friend, Dr. Akhlesh Bhargava ji. So, without wasting much time, I would like to request for today's webinar to P. Jayaprakash Narayan sir. Welcome, sir. You are the senior most, our inaugurator of today's webinar. Welcome, welcome, sir. Swagatam.
Thank you. So shall we commence?
Yes, sir. Your voice is clear, sir. Welcome, sir. Sir is senior Siddha expert. Sir is founder of Siddha unit there in Karnataka, in Chennai, sorry. Means just saying something about him is just as we are showing a light lamp to the sun. So I don't want to be between the audience and sir. Please bless us, sir, on your views and your experiences for cancer treatment. Thank you, sir. Welcome, sir.
Om Namah Shivaya. Today, we are adopting the anti-cancer day. At the outset, we all have to congratulate our moderator and organizer, Dr. Sharma ji, who suitably selected this topic, the best medicine for cancer support. Very, very carefully worded topic. Cancer support. Internationally, 95 lakhs of people are dying every year. In India, daily death rate is 1,300. And annually, 8 lakhs people are dying. In the cancer population, US stands first, next China, next comes India. So we are all having a very strong responsibility to redeem our people from the tentacles of cancer. As a spiritual scientist of India, either Ayurveda, Siddha, or Unani physicians, we are all spiritual scientists And we are not harboring any discrimination between systems. This I must make it clear. The modern medicine have considerably reduced the mortality and morbidity by surgery, by organ transplantation, by emergency management, and acute infection management. In this area, their role is very unparalleled. But this area covers only 32%. In the remaining 68%, there is a lengthy, long list of diseases known as lifestyle disorder or non-communicable disorders, where the modern medicine is struggled, and especially in the treatment of cancer. Can we switch over to this PowerPoint presentation?
Yes, sir. Yes. Share then a screen, then start PowerPoint.
The role of higher order of Siddha medicines in the treatment of cancer. Next.
Great, sir. Great, sir.
The theme of the presentation: gold preparations play a vital role in treating cancer. Siddha is having potentials to treat cancer. Well-prepared mercurial drugs can be safely administered even for years together. Siddha drugs are more cytoprotective than cytotoxic. Modern oncologists are showing interest in integrated approach to treat cancer. See, the two scientists, Dr. Muthukumaran and Dr. Alisa of Concordia University of Canada has done adequate evaluation in Tangaparpam, which is an analog of Swarnapasma. First, they have done the toxicity test. Only after knowing it is toxic free, they have tried on the cell lining. And they have come to the conclusion that gold particles, the particles of Tangaparpam, enters into the cell without any resistance of the cell membrane. This is their findings. But our ancient were well known that gold ions will transport mercury and other cancer drug into cell. That is why they have evaluated our Purna Chandrodayam and Maharatura Senduram, which is a combination of mercury and gold. I am furnishing for your kind reference a list of internal drugs and external drugs. Internal drugs: Tangaparpam, Purna Chandrodayam, Rasa Senduram, Kala Megha Narayana Chenduram, Ayavira Chenduram, Rasagandhi Melugu, Nandi Mai, Idivalladi, Mahavalladi Lehyam, Kandaga Rasayanam, Serangottai Nai, and Lingachonduram. External drugs: Mattan Thailam, Virana Sanjeevi Thailam, Megha Virana Thailam. Now we are entering into few case studies. This is the case of Mrs. Geeta. He went to a 5-star hospital about some abdominal complaint. when she was examined, they have enumerated so many complications like ovarian tumor, sulfangitis, endometritis, and lymphoadenopathy, etc. So, they entered into a surgical removal of ovaries, uterus, and fallopian tubes on February 2020. The patient was asked to come back after 1 month for review and the continuous employment of chemotherapy. When the patient came back for review, he was developing ascites. When the ascites fluid was aspirated and examined, malignancy was found. And they have employed palliative treatment, aspirating the ascitic fluid, and then advised her discharge with a guideline to follow chemotherapy. But the patient, Geeta, refused to undergo chemotherapy, and she came to Siddhalaya for my clinic. And we have done a PET scan which revealed bilateral external iliac region hypotense collection in bilateral external iliac region, mild metabolically active peritoneal thickening in the pelvis. So, it indicates the recurrence of cancer. In Siddha, we treated her the above mentioned drug like Tagaparpam, Purna Chandrodayam, Rasagandhi Milgu, etc., for 1 year. She came on 19 April 2021. We have taken a PET scan which reveals no significant metabolically active retroperitoneal glands. No evidence of metabolic active disease. The patient compelled me to issue her a certificate of recovery and a fitness certificate to join duty as the human resource executive in their company. This is the scan, comparative scans. Before starting Siddha treatment, in the middle of Siddha treatment, and the end of the Siddha treatment. Now, Geeta has totally recovered and joined duty as human resource executive, and he is under constant follow. Another case in interactive approach of ovarian cancer report. The patient, Jayalakshmi, 75 years old. He was operated for a benign ovarian tumor on 2010. Again, in 2013, he developed swelling of the abdomen and went to the same hospital in Nagapattinam, where they have now on 23/8/13, they removed the recurrent tumor, that is poorly differentiated carcinomatous tumor, and subjected it to biopsy, and they found as carcinoma of ovary. This is a letter of MC Hospital, Nagapattinam, who referred the case to the Adayar Cancer Institute, the pioneer of cancer hospitals in the whole India, that is Adayar. In Adayar, this is a letter given by them, documented by us. What they have said, since she has undergone already surgery and the Secondaries have engulfed the iliac vessels and the whole pelvic floor is occupied by secondary deposits. The case is unfit for surgical or chemo intervention and it is being referred back to the same hospital of Nagapattinam. The patient was brought to Siddhalaya in 2013 and we have started treatment after explaining to her and the relatives the reality of the case. To our surprise, 8 years Jayalakshmi survived. After 4 years, appreciating her loyalty, he supplied medicine free of cost. Irony played a very vicious role. Her son, who was acting as a messenger between her and our hospital, died in accident 2 months back. Following the shock, the Jayalakshmi madam developed the terminal complication of a long-term cancer case and he died 2 months back. What is recorded in this case? She came to us in 2013. She was alive between December 2021. So for almost 8 years, the abundant case was protected by Siddha medicine. And this is a case of skin cancer. The patient Periannan was diagnosed by the oncologist as having squamous cell carcinoma and he was advised the amputation of the ring finger, which he refused. See, this is the stage of ulcer when he came to Siddhalaya. Now, after 1.5 months treatment, this is the stage of the ulcer. The surface is healing. The wound margin is narrowing. The patient feels satisfaction in the improvement of the case. Similarly, we are handling a lot of breast cancer also. In those cases, after diagnosing the cancer by biopsy and PET scan, we are giving pre-treatment to the patient for 3 months or 4 months. Then after due examination about the shrinking of the tumor, the surgeons doing the excisions of the breast. And after excision of the breast, they are administered Siddha medicine in the place of chemotherapy. And we are maintaining documentation. Nowadays, we are having a lot of breast cancer patients in our list. See, today, Cancer Day. So, the Chennai Indian Express have called for a status report from various 3-star, 5-star hospital. In that page, we also have given a status report. This is not, I consider this is not our status report. This is the status report of Siddha system of medicine. Conclusion. Siddha system of medicine is having potentials to treat cancer cases. In this respect, my experience shows integrative approach will be very useful for the humanity. To our great surprise, the oncologist, surgical oncologist in the capital, Chennai, are very cooperating with me and with the Siddhalaya, and they are developing confidence in Siddha drugs, and in some cases, they are referring the cases to Siddha physicians also. So, it is my conclusion, Siddha system of medicine with its strong potentials, by cooperating with modern surgical oncologists, they can be useful to the humanity very much. Not only that, in emergency conditions like uncontrollable pain and the peritoneal fluid collection, in the pleural effusion, they are helping us and they are associating with the palliative treatment. And in Tamil Nadu, we are successfully running the integrative approach. This submission. After thanking all of you for your patient hearing, I conclude my presentation. Thank you.
Great, sir. You have highlighted all aspects of Siddha and with practical cases. Really, regards with gratitude, sir. Thank you very much. Now, before calling our respected Ramaswamy sir, I would like to have your kind permission to call upon Dr. Akhlesh Bhargava, as he is now attending our webinar, and then after half an hour, he will be attending other webinar. So kindly excuse me and permit me to call upon Dr. Akhlesh Bhargava, cancer specialist from Indore Ashtang Ayurveda College, where I have also studied in 1986. So welcome, Dr. Akhlesh.
Thank you very much, sir. Thank you very much, sir.
Welcome.
Thank you very much for inviting me such beautiful platform for 300 series, and welcome to all of you. सबसे पहले आपके लिए एक सर यहाँ से बैठती करी ताली बजा रहा हूँ आपके लिए.
खूब आशीर्वाद.
निश्चित रूप से मेरी आपसे इस बारे में पहले भी बात हुई कि ये एक ऐतिहासिक क्षण चल रहा है कि रोजाना एक वेबिनार हो रहा है, जहां पर लोग महीनों तक वेबिनार नहीं करा पाते. रोजाना एक्सपर्ट्स को लेकर, इंटरनेशनल एक्सपर्ट्स को लेकर के जो वेबिनार किया जा रहा है विभिन्न प्रकार की डिजीज से, पूरे भारत में नहीं, अभी तो पूरे विश्व में अलग अलग जगह पर इसकी ख्याति बढ़ी रही है और लोगों को इसका फायदा हो रहा है. इसके लिए आप कोटि कोटि धन्यवाद के पात्र हैं सर. ईश्वर आपको शतायु से भी अधिक करे ताकि आयुर्वेद के माध्यम से आप लोगों की सेवा करते रहे. विश्व आयुर्वेद दिवस 4 फरवरी 2022. प्रतिवर्ष हम विश्व आयुर्वेद कैंसर दिवस तो मनाते ही है. इसके पीछे हमारे एक संकल्प लेते हैं कि वर्ष भर में हम क्या कार्य करने जा रहे हैं कैंसर के रोगियों के लिए. इस बार की जो थीम है वो है क्लोज द केयर गैप, अर्थात गैप को कम करना. हम लगातार देखते हैं कि कैंसर के मरीजों का जब इलाज स्टार्ट होता है तो आर्थिक स्थिति खराब होने के कारण या कीमोथेरेपी, रेडियोथेरेपी को उपद्रव होने के कारण, अन्यथा कई प्रकार के सामाजिक समस्याएं आने के कारण किसी भी प्रकार से इलाज को छोड़ देता है. तो हम चाहते हैं कि हम कैंसर के मरीजों और डॉक्टर्स के बीच में, डॉक्टर्स के साथ सामाजिक संगठन भी हैं, राजनीतिक संगठन भी हैं और जितने भी लोग जो समाज सेवा से जुड़े हुए हैं उनके बीच में गैप जो है उसको कम किया जाए, ताकि हम आसानी से कैंसर के मरीजों के पास जा सके, उनकी समस्याएं सुन सकें और डेफिनेटली उनको सोल्व कर सके. क्योंकि इसमें एक सत्वोज चिकित्सा जो आयुर्वेद में है कि यदि रोगी का मन और बल बढ़ा हुआ हो तो निश्चित रूप से कैंसर जैसी गंभीर बीमारी को समाप्त करने में सहायता मिलती है. पिछले कुछ सालों से यहाँ पर हमने एक कैंसर की यूनिट खोली हुई है, जिसमें प्रतिवर्ष लगभग 300 से 400 कैंसर के मरीज आयुर्वेद का इलाज लेने आते हैं और हमारे पास कैंसर के जो वुंड्स के पेशेंट्स हैं वो भी लगातार आ रहे हैं. हमारे पास जो कैंसर के मरीज अभी तक आ रहे हैं उनमें हम देख रहे हैं कि कुछ कैंसर के मरीज उस प्रकार के हैं जो उनकी ओल्ड एज है और जो कीमोथेरेपी अथवा रेडियोथेरेपी नहीं ले पा रहे हैं किसी कारण से, या कोई गंभीर बीमारी है एंड दे वांट टू टेक ओनली एंड ओनली आयुर्वेदिक मेडिसिन। सेकेंड टाइप ऑफ पेशेंट आज जिनको कीमोथेरेपी और रेडियोथेरेपी चल रही है और वो अपने जो कॉम्प्लिकेशंस होते हैं उनको दूर करने के लिए आयुर्वेदिक ट्रीटमेंट लेना चाहते हैं। और निश्चित रूप से आज प्रचार प्रसार के द्वारा इतना डेवलप हो चुका है आयुर्वेद कि आज हमारे पास जो मरीज आ रहे हैं वो कीमोथेरेपी शुरुआत करने से पहले ही 7 से 8 दिन के पहले आ जाते हैं और उनको हम लगातार पित्त शामक दवाएं, काकोलिया आदि गण की मेडिसिन है, गिलोय सत्व है, आमल की रसायन, सदापार, पुष्पिका चूर्ण, एरेंड आदि का प्रयोग करवा रहे हैं और इसके अच्छे परिणाम सामने आ रहे हैं। क्योंकि कीमोथेरेपी के दौरान जो बाल का उड़ना, त्वचा में रेशेज पड़ जाना, भूख नहीं लगना, नींद नहीं आना, डिप्रेशन में आ जाना, ये सब जो कॉम्प्लिकेशन आते हैं इन कॉम्प्लिकेशन को दूर करने में हम लगातार सक्षम हो रहे हैं। जब हम ये देख रहे हैं कि रेडियोथेरेपी निश्चित रूप से हेड एंड, यदि हम बात करें कि हेड एंड नेक का जो कार्सिनोमा है उसमें वुंड के ऑपरेशन करने के बाद में एक घाव बनता है और उसके बाद में रेडियोथेरेपी दी जाती है। तो धीरे धीरे क्या होता है कि वो घाव भरना मुश्किल हो जाता है और रेडियोथेरेपी के कारण वहाँ के जो हेल्दी टिश्यू होते हैं वो भी धीरे धीरे डैमेज होने लगते हैं। तो हमने ये गोघृत पे ये स्टडी की है कि गोघृत का यदि लोकल और ओरली यदि हम प्रयोग करवाते हैं तो इससे जो रेडिएशन के कारण जो हार्डनेस आती है वुंड्स में वो सॉफ्ट हो जाती है। क्योंकि रेडिएशन के कारण कई बार हम देखते हैं रोगी का मुंह खुलना भी बंद हो जाता है और कई बार तो ऐसा भी देखा गया है कि उसकी इसोफेगस में स्ट्रक्चर आने के कारण निगलना भी बंद हो जाता है। तो इसमें यदि हम गोघृत का प्रयोग करते हैं, गोघृत के साथ में हम गिलोय सत्व का, प्रवाल पिष्टी का, कामदूधा रस का, इन सब चीजों का प्रयोग करते हैं तो उससे रेडिएशन के उपरांत जो होने वाले प्रॉब्लम्स हैं उनसे हमें राहत मिलती है। इसके बाद में तीसरी तरीके वो मरीज हैं जो किसी तरीके का सर्जरी, इम्यूनोथेरेपी और कीमोथेरेपी या तो रेडियोथेरेपी ले चुके हैं, लेकिन वो चाहते हैं कि भविष्य में उनको किसी भी प्रकार का मेटास्टेसिस ना हो। क्योंकि हमने देखा है इंडियन कैंसर सोसाइटी के डाटा भी बताते हैं कि लगभग 76% जो कैंसर के मरीज हैं उनको 1 वर्ष के भीतर दोबारा मेटास्टेसिस हो जाता है। तो हमारी मेडिसिन के द्वारा, क्योंकि आयुर्वेद में बताया गया है कि यदि थोड़ा सा भी दोष वात पित्त कफ के रूप में यदि शरीर में पड़ा रहे तो वो जैसे ही अनुकूल कारण मिलते हैं वैसे ही वो डेवलप हो जाता है और दोबारा कैंसर की उत्पत्ति हो सकती है। जैसा कि आचार्य चरक ने विषम ज्वर में कहा है, अधिशेते यथा भूमि बीजम काले होती, अर्थात यदि भूमि में कोई बीज पड़ा हुआ है तो वो निश्चित रूप से जैसे ही कोई समय आता है वैसे ही अपना प्रवृत्ति दिखाता है और वृक्ष के रूप में बाहर निकल के आता है। उसी प्रकार के जैसा हम देखते हैं कि दोष वात पित्त कफ के बारे में हमेशा धारणा रही कि वात पित्त कफ को किसने देखा है, इसे देखा नहीं जा सकता, इसे लक्षणों को और कर्मों के द्वारा महसूस किया जा सकता है। इसलिए कई बार हमने मरीजों में देखा है कि जब कैंसर का मरीज ठीक हो चुका होता है तो उसका एक पेट स्कैन कराया जाता है जिसमें यह देखा जाता है कि कहीं शरीर में कोई अन्य कैंसर की कोशिकाएं तो बची हुई नहीं है और इसमें देखा जाता है कि कोई भी कैंसर की कोशिका नहीं बची है, पेशेंट इज फ्री फ्रॉम कैंसर। लेकिन कुछ समय बाद फिर ऐसा देखते हैं कि कैंसर की दोबारा उत्पत्ति हो जाती है। ऐसी स्थिति में शरीर में कोई ना कोई अवशेष दोष के रूप में जो कैंसर कोशिकाएं होती है, यदि उनका पूर्ण रूप से संबंध नहीं किया गया तो कैंसर की दोबारा उत्पत्ति हो सकती है। इसलिए हमने देखा है कि आयुर्वेद दवाइयों का लगातार पेशेंट को हर्बल और हर्बल मिनरल मेडिसिन का सेवन करवाते हैं जिससे उसको आने वाले समय में मेटास्टेसिस से राहत मिलती है। चौथी प्रकार के वो पेशेंट है जिनको किसी भी प्रकार के कैंसर का ऑपरेशन कराने के बाद में घाव हो जाते हैं। क्योंकि ये स्टडी हो चुकी है कि कीमोथेरेपी और रेडियोथेरेपी के कारण कैंसर के घाव नहीं बढ़ती हैं, इसलिए हमने कुछ पेशेंट्स पर जात्याधिकृत जो गाय की घी से बनी हुई दवाई है, जाति निम्न पटोला नाम नक्त मालस्य पल्लवा सिक्तम स मधुकम कुष्टम द्वय निश्चय कटुरोणी मंजिष्ठा तुत्यकम सारिवम पद्म के लोत्रम अभिया, ये सारी मेडिसिन से मिलकर के इनका कॉम्बिनेशन ऐसा है कि ये कैंसर के घाव के पेन को, स्वेलिंग को, रेडनेस को आदि को कम करती है, वहीं के फाइब्रोसिस को कम करती है, वहां पे हेल्दी सेल्स को बढ़ाती है, इसलिए कैंसर का घाव धीरे धीरे जल्दी सही होने लगता है। तो इस प्रकार के मरीज भी हमारे पास आ रहे हैं। आप सरप्राइज करेंगे कि कुछ मरीज हमारे पास इस प्रकार के भी आ रहे हैं। अभी 3 और 4 महिलाएं ब्रेस्ट कैंसर की हैं जो केवल इसीलिए हमारे पास आ रही हैं कि उनकी माँ को अथवा मौसी को पहली पीढ़ी में ब्रेस्ट कैंसर रहा था। अब वो चाहती है कि किसी भी प्रकार की समस्या उनको पैदा नहीं हो, क्योंकि हम देख रहे हैं कि 5 से 10% जो केसेज है उनमें कैंसर जेनेटिक है। तो वो भी आयुर्वेदिक दवाइयां ले रही हैं जिनसे उनको भविष्य में किसी प्रकार की कोई दिक्कत ना हो। तो हमने जब कैटेगराइजेशन किया तो लगभग इस प्रकार के 6 तरह के मरीज कैंसर के हमारे पास आ रहे हैं और लगातार दवाइयां ले रहे हैं। हमेशा ये बात आती है कि क्या आयुर्वेदिक दवाइयां कैंसर में फायदा करती है? निश्चित रूप से लगातार मरीजों का आना ओपीडी में ये इस बात का द्योतक है कि कैंसर के मरीज लाभ प्राप्त कर रहे हैं। निश्चित रूप से आज और अधिक अनुसंधान की आवश्यकता है, क्योंकि हम ये तो देख रहे हैं कि कैंसर में जो कीमोथेरेपी और रेडियोथेरेपी के कॉम्प्लिकेशंस हैं उनमें तो मरीज फायदा ले ही रहे हैं, लेकिन मेरा जो पर्सनल एक्सपीरियंस है कि यदि कैंसर खत्म होने के बाद में आयुर्वेदिक दवाइयों का प्रयोग करते हैं, क्योंकि आयुर्वेदिक दवाओं का जो कार्य करने का तरीका वो कोशिकीय स्तर पर है। जैसा कि हम पंचकर्म में देखते हैं, हम कोई भी द्रव्य लेते हैं तो वो एब्जॉर्ब होने के बाद में कोशिकाओं में जाता है, कोशिकाओं में रिसाइलिंग होती है उसकी और अपद्रव्यों को लेकर के वापिस आता है वो स्टमक में और उसके द्वारा वमन के द्वारा निकाला जाता है। इसी प्रकार कैंसर के मरीज में यदि सिंगल सेल में भी, एक कोशिका में भी यदि किसी भी प्रकार का दोष अवशेष बचा है तो उसे साधारण पंचकर्म की क्रिया के द्वारा बाहर निकल जाता है और उसे आयुर्वेदिक दवाओं के द्वारा उसका शोधन किया जाता है। जैसे हम शोधन और शमन की चिकित्सा में तुलसी की बात करें तो आज से 5000 वर्ष पूर्व तुलसी का वर्णन है और इसको कैंसर के रूप में, अर्बुद के रूप में काम में लिया जाता रहा है। अष्टांग हृदय में के 8वें अध्याय में ग्रंथि और अर्बुद में इसका उपयोग बताया हुआ है। तो 5 प्रकार की तुलसी को हम यूज में ले सकते हैं। तुलसी में एक प्रकार का पदार्थ पाया जाता है जिसे हम ग्लूटाथियोन बोलते हैं। ये ग्लूटाथियोन ब्रेस्ट कैंसर में और मुंह के कैंसर में बहुत ही अत्यधिक लाभदायक है। इसको तुलसी को जब हम लेते हैं और इसको चबाते हैं तो वहाँ की जो कैंसर का ट्यूमर है उसकी ब्लड सप्लाई धीरे धीरे कम होती जाती है, एंजियोजेनेसिस कम होता जाता है, ट्यूमर की साइज धीरे धीरे घटती जाती है। और इसको जब तुलसी को मिक्सी में लेकर पीसते हैं तो इसमें एक प्रकार का पदार्थ यूजेनोल निकलता है। यूजेनोल जो कैंसर की जो कोशिकाएं होती हैं उनके डिवीजन को कम करता है। निश्चित रूप से कैंसर कोशिकाओं का डिवीजन कम होगा तो उसके ट्यूमर की साइज धीरे धीरे घटती जाती है और कैंसर का दूसरे स्थान पर जाना अर्थात मेटास्टेसिस होना कम हो जाता है। ऐसा ये इस पर कई पेपर भी पब्लिश हो चुके हैं और इसका फायदा इसलिए भी है क्योंकि तुलसी क्या करता है, कोर्टिसोल को कम करता है, एड्रेनलिन को कम करता है। कैंसर के मरीज में हम देखते हैं कि कोर्टिसोल बढ़ा हुआ होता है स्ट्रेस के कारण, तो तुलसी का प्रयोग करने से ये धीरे धीरे कम होता है। यदि हम कैंसर के कारणों में जाते हैं तो कैंसर के बड़े कारणों में होता है सिगरेट का पीना, तंबाकू का सेवन करना। तो इसमें चूंकि तुलसी में एक मेंथोल नाम का पदार्थ पाया जाता है, इसको खाने के बाद में रोगी को महसूस होता है कि उसको ठंडक महसूस हुई है और उसको इन अपद्रव्य और मादक पदार्थों से रोका जा सकता है। तुलसी एक COX-2 एंजाइम होता है जो स्वेलिंग के लिए जिम्मेदार है। शरीर में कोशिकाओं में स्वेलिंग के लिए जिम्मेदार है, तो तुलसी COX-2 एंजाइम को धीरे धीरे कम करती है। इसलिए केवल तुलसी एक सिंगल ड्रग ऐसी रामबाण दवा है जो कैंसर को नहीं होने देती है। यदि कैंसर हो भी जाए तो उसके ट्यूमर की ब्लड सप्लाई को कम कर देती है और यदि ट्यूमर की साइज बनी हुई है तो उसमें कैंसर सेल डिवीजन को कम करती है और यदि कैंसर सेल एक स्थान से दूसरे स्थान में पहुंचने की क्षमता रखते हैं तो मेटास्टेसिस को भी रोकती है। 2006 में पबमेड में एक स्टडी हुई, इन विवो स्टडी इन माइस। वहां पर चूहों को आयोडीन 131 का सेवन करवाया गया, उनमें ट्यूमर डेवलप किया गया और लगातार तुलसी का भी प्रयोग किया गया तो देखा गया कि 63% केसेज में ट्यूमर जो था वो धीरे धीरे कम होता गया। 2012 में हेड एंड नेक कैंसर में देखा गया कि यदि रेडिएशन के दौरान तुलसी का लगातार प्रयोग किया जाता है तो उससे होने वाले जो उपद्रव हैं, जिसमें रोगी का मुंह का कम खुलना है, रोगी को निगलने में दिक्कत आना, रोगी की लार कम हो जाना, रोगी की स्वाद की जो कलिकाएं होती है जिसमें रोगी को टेस्ट आना बंद हो जाता है, उन सब की चीजों से भी राहत मिल सकती है। तो केवल तुलसी ही एक ऐसा पदार्थ है, किंतु हमें यहाँ पे ध्यान रखना चाहिए कि तुलसी कटु तिक्त रस है और इसका विपाक भी कटु है, इसलिए ये बीटा सेल के द्वारा बनने वाला जो इंसुलिन है उसको कम करता है, तो इसकी मात्रा को ध्यान में रखना चाहिए। सामान्यतः हम ये देखते हैं कि यदि रोगी हाइपरग्लाइसेमिक है तो उसको 20 पत्ते, सामान्य अवस्था में है तो 15 पत्ते, और यदि हाइपोग्लाइसेमिक है क्योंकि ये और कम करेगा इसलिए इसमें तुलसी के पत्तों की मात्रा 10 निश्चित की गई है। और यदि क्वाथ के रूप में लें तो 50 से 100 ml, चूर्ण के रूप में 3 से 5 ग्राम, और अभी पंच तुलसी अर्क मार्केट में उपलब्ध है उसका प्रयोग भी किया जा सकता है। तुलसी जो करती है प्रोटेक्शन करती है, प्रोटेक्टिव मटेरियल ऑफ द इनस्टेबिलिटी ऑफ जीन। हम कैंसर में मानते हैं कि ये तुलसी जो है वो जो जीन की जो लेवल की जो विकृति होती है उसको दूर करती है। तो इस प्रकार हम देखते हैं कि केवल एक तुलसी ही ऐसा द्रव्य है जो कैंसर को रोक सकता है लगातार यदि इसका यूज किया जाए। और इसके बाद में हम देखते हैं कि कुछ और द्रव्यों के बारे में अभी बात करेंगे, जैसे हल्दी है। हल्दी में हम देखते हैं कि हल्दी में कैंसर कोशिकाओं को मारने के लिए काफी सारी रिसर्च हो चुकी है, इसका अमेरिकन पेटेंट भी हो सकता है। श्री चित्रा तिरुनाल इंस्टीट्यूट मेडिकल साइंस फॉर टेक्नोलॉजी और ICMR ने मिलकर एक स्टडी की है। उन्होंने देखा है कि कैंसर सेल को मारने के लिए जैविक हल्दी का जो प्रयोग किया जाता है वो बेहतरीन है। तो इस प्रकार के द्रव्य हमारे पास बहुत सारे हैं। कुछ द्रव्यों की बात जो प्रैक्टिकली मैंने यूज किया है और इस पर कुछ पेपर भी पब्लिश हो चुके हैं। यदि हम अरेंड तेल की बात करें, अरेंड की बात करें, रिसिनस कम्युनिस्ट, तो इसमें एक स्ट्रॉन्ग पॉइजन पाया जाता है जिसको हम कहते हैं रिसिन। ये लिम्फोमा में बहुत अच्छा कार्य करता है। टेक्सास यूनिवर्सिटी में इसकी रिसर्च हो चुकी है। लगभग 250 पेशेंटों में इसका प्रयोग किया गया, तो वहां पर देखा कि लिम्फोमा के 60% केसेज अरेंड का प्रयोग करने से कम हुए। क्योंकि अरेंड, हम कैंसर के बारे में बात करें तो कैंसर जो होता है उसमें कफ की प्रधानता होती है। आचार्य सुश्रुत ने जब इसकी संप्राप्ति बताई तो उन्होंने वहां पे बताया, गात्र प्रदेश से क्वचितो दोषा सम्मूर्छिता मांसम अभिप्रोड्यूस्य वृत्तम स्थिरम मंद्रुजम महानतम अनंत मूलम वृद्धिया चिरपाकम। तो ऐसा जब उन्होंने लक्षण दिया तो वहां पे उन्होंने देखा कि सभी दोषों में कफ की प्रधानता होती है। तो कफ की प्रधानता होती है तो अरंड जो होता है वो श्रोतरोध को कम करता है, मंदाग्नि को कम करता है और वात शामक भी है। तो इस स्थिति में इसका प्रयोग किया जाता है। और मैंने देखा है कि जब कैंसर के रोगी को मॉर्फिन का ज्यादा अधिक प्रयोग किया जाता है दर्द शामक दवाई के रूप में, तो उसको हमेशा कॉन्स्टिपेशन बना देता है। ऐसी स्थिति में अरंड का प्रयोग किया जाएगा तो हमें दोहरा फायदा मिलता है। तो यदि रोगी को, कैंसर के रोगी को कॉन्स्टिपेशन होता है अथवा दर्द से निजात दिलाने के लिए एरंड का एक अच्छा प्रयोग है और लगातार हम इसको हमारे मरीजों के बीच में काम में ले रहे हैं। थोड़ी और मेडिसिन की बात की जाए, यदि हम सदाबहार की बात करें, एकिडेंसर रोजिया, सदाबहार एक सफेद पुष्प वाला जो सदाबहार होता है वो कैंसर में बहुत ही अधिक उपयोगी बताया गया है। इसमें 2 एल्कोलॉइड पाए जाते हैं, विनक्रिस्टिन और विनब्लास्टिन। ये दोनों कैंसर को खत्म करने के लिए काम में लिए जाते हैं। कुछ कंपनियां भी इसको बनाती है, जैसे अभी सिप्ला कंपनी एक मेडिसिन बनाती है साइटोक्रिस्टिन, उसमें ये दोनों एल्कोलॉइड पाए जाते हैं। लेकिन उसके साथ में जो प्रिजर्वेटिव मिलाए जाते हैं, 2 प्रकार के प्रिजर्वेटिव हैं, विनक्रिस्टिन और विनब्लास्टिन। ये दोनों प्रिजर्वेटिव जो होते हैं वो खुद कैंसर का कारण है। तो आज मार्केट में अभी जितनी भी दवाइयां हमारे पास आ रही हैं उनमें कोई ना कोई प्रिजर्वेटिव मिलाया जाता है और वो कैंसर का कारण बनता है। यदि हम देखें कि कैंसर से बचने के क्या तरीके हैं, तो हाल ही में हम देख रहे हैं कि हमारे बाजार में, हमारे घरों पर पैक्ड फूड का, जो डिब्बाबंद भोजन का प्रयोग किया जा रहा है, उसमें बिस्फिनोल नाम का एक प्रिजर्वेटिव मिलाया जाता है और ये प्रिजर्वेटिव कैंसर कारक होता है। और हम देख रहे हैं कि अभी बाजारों में भी हम देखते हैं कि लोग अखबारों में खाना खाते हैं। अखबारों में एक डाई होती है, एल्कोहल की एक डाई होती है जिसे हम आइसोब्यूटाइल फेटालेट कहते हैं, ये कैंसर का कारण है। अभी कुछ समय पहले हमने एक मिशन चलाया था कि जो मिठाइयाँ होती हैं उन मिठाइयों में जो कलर्ड मिठाइयाँ होती है उसमें मेटालिन सेफोलाइट नाम का एक पदार्थ मिलाया जाता है, वो मेटालिन सेफोलाइट कैंसर का कारण बनता है। सरकार इस पर लगातार काम कर रही है। सरकार के निर्देश हैं कि स्कूलों के बाहर और हॉस्पिटलों के बाहर लगभग 100 मीटर तक कोई भी रेडिएशन के लिए इस तरह का मोबाइल टावर नहीं होना चाहिए। अभी हम आयुर्वेद की तरफ जाएं, आयुर्वेद के RVR रसायन इन सब का हम प्रयोग करेंगे तो निश्चित रूप से कैंसर से दूर रहेंगे। थोड़ा सा हम इस मंच पर अगर गो मूत्र की बात नहीं करेंगे तो थोड़ा सा कमी रहेगी। हमारा ऐसा मानना है और ऐसी कई रिसर्च भी हो चुकी है, जो कैंसर का जो कारण है मुख्यतः वो है एसिडिटी। शरीर में जब अम्लता बढ़ती है, हमारे शरीर में जब ऑक्सीडेशन चलता रहता है और उसके बाद में जो फ्री रेडिकल्स बनते हैं, उन फ्री रेडिकल्स के कारण शरीर की कोशिकाओं की एसिडिटी बढ़ती है, उनका विभाजन बढ़ता है और वो कैंसर का कारण बनता है। इसीलिए क्या करते हैं हम, क्या कैंसर को रोगी को बोलते हैं कि उसे नारियल का जूस पीना चाहिए, विभिन्न प्रकार के जूस पीना चाहिए, सोडियम बाइकार्बोनेट का प्रयोग करना चाहिए। ऐसी अवस्था में यदि गौमूत्र का प्रयोग किया जाएगा तो शरीर की एल्कलिनिटी बढ़ती है और कैंसर कोशिकाओं का वजन कम होता है, कैंसर समाप्त होता है। क्योंकि इसकी जो पीएच है गौमूत्र की वो 8.4 से 9.4 तक होती है। ये हाईली एल्कलाइन है और ये कैंसर कोशिकाओं को मारता है। यदि हम इसका संगठन देखें तो उसमें 95% वाटर है, 2.5% यूरिया, इसमें 24 प्रकार के मिनरल्स पाए जाते हैं, सोडियम, पोटेशियम, कैल्शियम ये पाए जाते हैं। और एक सबसे बड़ी विशेषता है कि इसमें साइटोकाइनिन नाम का एक प्लांट हार्मोन पाया जाता है जो कैंसर कोशिकाओं को मारने के लिए जरूरी है। गौमूत्र इतना अधिक लाभकारी है कि इसमें एक यूरोकाइनेज नाम का तत्व पाया जाता है जिसे हार्ट के रोगियों में जो थक्के बन जाते हैं वहां पर इसको काम में लिया जाता है। चाइना ने इसका पेटेंट भी ले रखा है। तो सिर्फ गौमूत्र एक ऐसी स्थिति है जिस प्रकार हम कहते हैं कि गाय का दूध सभी बीमारियों में और पोषण के लिए उत्तम है, उसी प्रकार गौमूत्र के द्वारा भी अरुचि मंदाग्नि को खत्म किया जाता है। जैसा कि मैंने अभी बात की थी कि हमारी कोशिकाओं में जो मंदाग्नि होती है, कोशिकाओं को सही प्रकार से कार्य नहीं करना, हम उसे ही मंदाग्नि बोलते हैं। तो जब हम इसका प्रयोग करते हैं, गौमूत्र का प्रयोग करते हैं, तो ये मंदाग्नि को खत्म करता है, कफ को खत्म करता है, स्रोतस का अवरोध दूर करता है, सारी शरीर की क्रियाएं सम्यक रूप से चलती हैं, तो निश्चित रूप से कैंसर जैसी कोशिकाओं पर लगाम डलती है। हर्बल मेडिसिन का प्रयोग करने के बाद में हम हर्बल मिनरल मेडिसिन का भी प्रयोग करते हैं। ज्यादातर हम देखते हैं कि स्वर्ण भस्म का प्रयोग किया जाता है। स्वर्ण भस्म के ऊपर CGRI में एक वहाँ की जो एथिकल कमेटी के द्वारा अप्रूव्ड एक रिसर्च हुई है, जिसमें उन्होंने देखा कि रेक्टल कार्सिनोमा के केस में यदि हम स्वर्ण भस्म का प्रयोग करते हैं, तो उन्होंने देखा 10 में से 7 मरीजों की जो रेक्टल कार्सिनोमा की ग्रोथ थी रेक्टम में, वो धीरे धीरे कम होती गई। क्योंकि हम देख रहे हैं कि जो स्वर्ण भस्म है उसमें लेखन का गुण होता है, लेखन हमारे जो ट्यूमर होता है उसको धीरे धीरे कम करता है। विषगर विरोधिक प्रशमन, अर्थात ये जो कीमोथेरेपी के दौरान जितना भी साइड इफेक्ट आते हैं, उसको स्वर्ण भस्म धीरे धीरे कम करती है। तो स्वर्ण भस्म का प्रयोग, और हीरक भस्म तो निश्चित रूप से षड्रस युक्त होती है और ये रसायन की तरह भी कार्य करती है। इसलिए धातुओं का प्रयोग आयुर्वेद में जो बताया गया है, कैंसर में बहुत ही लाभकारी है। तो इस प्रकार हम देख रहे हैं कि कैंसर में बहुत सारी मेडिसिन का लगातार यूज किया जाता है और इसके फायदे भी काम में आते हैं। कैंसर वुंड की यदि बात करूं, हमारे पास कैंसर के रोगी आ रहे हैं, तो उनमें हम प्रतिसारणी क्षार का प्रयोग करें, मृदु प्रतिसारणी क्षार का प्रयोग करते हैं। इससे वहां पर स्क्रैपिंग होती है और घाव को भरना धीरे धीरे जल्दी होता है। ये चूंकि कैंसर का जो घाव होता है वो उसकी एंजियोजेनेसिस होती है, इसलिए ज्यादा उसमें तीक्ष्ण क्षार का प्रयोग नहीं करना चाहिए, इसमें ब्लीडिंग होने की संभावनाएं होती हैं। तो इस प्रकार हम देख रहे हैं कि कैंसर के मरीजों में लगातार आयुर्वेदिक औषधियों के द्वारा हम लाभ प्राप्त कर रहे हैं। और यहाँ पर देखिए कि मैं योगा और प्राणायाम की जो विशेषता है वो भी आपको बताना चाहूंगा कि योगा और प्राणायाम के क्या फायदे हैं। 1931 में एक नोबेल पुरस्कार मिला कैंसर सेल मेटाबॉलिज्म के लिए डॉक्टर बार्बर को। उन्होंने देखा कि जब ऑक्सीजन अधिक शरीर में जाती है, क्योंकि ऑक्सीजन भी एल्कलाई प्रवृत्ति की है, क्षारीय प्रवृत्ति की है, तो उसमें क्या होता है कि इसका जो pH है ऑक्सीजन का वो 8.4 है। जैसे जैसे शरीर में ऑक्सीजन की मात्रा बढ़ती है, वैसे वैसे कैंसर सेल का डिवीजन जो होता है वो कम होता है और कैंसर की समाप्ति होती है। इसलिए हमें चाहिए कि कैंसर के रोगी को योगा की तरफ ज्यादा हम झुकाव रखें, ताकि ऑक्सीजन को अधिक से अधिक लिया जा सके। हमारे यहाँ जितनी भी आयुर्वेदिक दवाएं हैं, जितनी भी सब्जियां जमीन से होती हैं, वो सभी शारीरिक प्रवृत्ति की होती हैं। लेकिन पिछले कुछ समय से हम देख रहे हैं कि अधिक कीटनाशक का प्रयोग करने लगे। कीटनाशक का अधिक प्रयोग करने के कारण हमारे खाने पीने की जितनी भी वस्तुएं हैं, हमारा पानी है और हमारी निश्चित रूप से जो आयुर्वेदिक औषधियां हैं, उनकी pH भी धीरे धीरे कम हुई है, एसिडिटी बढ़ रही है। जब हम कहते हैं कि आयुर्वेदिक औषधियों का प्रभाव नहीं हो रहा है, निश्चित रूप से उसके उगाने की प्रक्रिया और उसकी शुद्धता की प्रक्रिया, उसके मानकीकरण की प्रक्रिया जब हम पूरी तरीके से समझ सकेंगे, तो इन आयुर्वेदिक औषधियों का 100% लाभ हम प्राप्त कर सकेंगे और रोगियों को अधिक से अधिक फायदा होगा। आज कैंसर दिवस पर मैं अपनी सभी संकल्प लेते हैं हम सभी की, हम आने वाले वर्षों में, चूंकि ये जो आज की थीम रखी गई है 2022 की क्लोज द केयर गैप, ये 2025 तक रहेगी, लगभग 3 साल तक। WHO ने थीम बनाई है कि हम रोगियों के, कैंसर के रोगियों के बीच में, डॉक्टर के बीच में कम गैप कम करें। सभी सरकारों को, भारत सरकार को और स्टेट गवर्नमेंट को ये बात हमें बतानी पड़ेगी कि WHO की जो कैंसर की थीम है वो ये थीम है, और इसमें इस गैप को कम करने के लिए, कैंसर के रोगियों का ध्यान रखने के लिए हमें निश्चित रूप से एक बजट की आवश्यकता होगी। उस बजट को आयुष डिपार्टमेंट को दिया जाएगा, ताकि हम उस बजट के द्वारा कैंसर के रोगियों के पास जा सकें, उनकी क्या तकलीफें हैं उनको हम सुन सकें, उनको सोल्व करने की कोशिश कर सकें। और डेफिनेटली जब ही हमने देखा है कि कैंसर के मरने वाली संख्या कितनी हो रही है, असंक्रामक बीमारियों की बात करें तो 3,80,00,000 पूरे विश्व में मरते हैं, जिसमें से लगभग 90 लाख मरीज कैंसर से मर रहे हैं, और भारत में लगभग 8.1
डॉक्टर साहब म्यूट हो गए हैं, अनम्यूट कीजिए।
जी सर। तो अनेक प्रकार के जितने भी सर्जरी है, कीमो, अभी मैं कुछ देर पहले मेरे एक सेमिनार में था जहां पर एक एलोपैथिक ऑन्कोलॉजिस्ट भी मेरे साथ थे, तो वो बोल रहे थे कि इम्यूनोथेरेपी का काफी फायदा है कैंसर में। तो निश्चित रूप से सर्जरी के बाद, कीमोथेरेपी के बाद और रेडियोथेरेपी के बाद अब पूरा एलोपैथिक साइंस भी इम्यूनोथेरेपी की तरफ जा रहा था, जहां पर हमने खुद कहा है आयुर्वेद में इम्यूनोथेरेपी, इम्यूनिटी बूस्टर मेडिसिन का लगातार प्रयोग शुरू से ही बताया गया है। हम मन और आत्मा पर भी जोर देते हैं, क्योंकि स्वस्थ व्यक्ति की परिभाषा में जहां पर हमने कहा कि समदोष समाग्निश्च समधातु मलय क्रिया प्रसन्न आत्म इंद्रिय मन है स्वस्थ देते। तो मन और आत्मा की चिकित्सा जो आयुर्वेद में बताई गई है, ऐसी चिकित्सा कहीं भी नहीं बताई गई है। हमारे यहाँ तो जो हमारा पेशेंट है उसे पुत्र के समान माना गया है कि हम पुत्र के समान मान करके उसकी रक्षा करें, उसकी सुरक्षा करें और उसका इलाज करें। आज भी समय आ गया है निश्चित रूप से कि कैंसर के रोगियों का झुकाव हमारी ओर बढ़ा है, आयुष की तरफ बढ़ा है। मैं किसी भी पैथी का विरोधी नहीं हूँ, लेकिन निश्चित रूप से मैं मानता हूँ कि सभी पैथियों में जो जो अच्छाइयां हैं वो निकलकर सामने आना चाहिए, ताकि हम एक दूसरे का विरोध किए बगैर एक दूसरे का साथ लेकर के एक दूसरे की समन्वित चिकित्सा पद्धति के द्वारा इस गंभीर बीमारियों में जो रोगी परेशान है उनकी किसी न किसी तरीके से हेल्प की जाए। हम संकल्प लेते हैं कि आने वाले समय में निश्चित रूप से हम इस बीमारी के लिए लोगों के बीच में जाएंगे और उनकी सहायता करेंगे। जय आयुर्वेद, जय भारत।
बहुत अच्छा अखिलेश जी, बहुत ही अच्छा आपने एक प्रस्तुतिकरण किया, बहुत ही अच्छा। मैं आपसे ऐसी ही अपेक्षा रखता हूं। आप रियली कैंसर का आप कर रहे हैं ऑलरेडी, और मैं देख रहा हूं कि आपकी ख्याति बढ़ती ही जा रही है, और कैंसर के विषय में आपकी विशेषज्ञता हमें हमेशा से प्रभावित करती रही है। और आप हमेशा ऐसे ही आगे बढ़ते रहें, कैंसर के रोगियों को आराम पहुंचाते रहें, क्योंकि उनकी लूट ज्यादा मची हुई है। उनको सहारा देने वाले कम है, उनको लूटने वाले ज्यादा हैं। हम उनमें से अलग होके यदि उनकी सहायता करते हैं तो रियली दैट विल बी ए ग्रेट अपॉर्चुनिटी फॉर आयुर्वेदा ऑल्सो टू execute these. Thank you very much. Now I would like to request Professor Dr. R.S. Ramaswamy ji, former Director General, First Director General of Central Council for Research in Siddha.
नमस्कार सर।
Namaskar. He has served in National Institute of Siddha as professor, and very senior dignitary, very senior members of various committees, head of the departments. Means I'm really overwhelmed that today Dr. P. Jayaprakash Narayan sir introduced Dr. R.S. Ramaswamy ji on this platform. I welcome him. I communicate my gratefulness and appreciate his kindness for accepting our proposal within very short notice. Thank you, sir. Thank you very much. Welcome, sir. Respected Ramaswamy, sir, kindly unmute yourself, sir.
Thank you very much for having
Welcome.
given a nice introduction about me. First of all, I thank you all for the opportunity given to me to share some of my views with you in this meeting. My teacher, Professor Dr. Jayaprakash Narayanan, has rightly pointed out the effectiveness of Siddha medicine in the treatment of cancer. He has got a vast experience in treating so many challenging cases. During my tenure as Director General of Central Council for Research in Siddha, the Ministry of Ayush was focused on evolving integrated therapy. So integrated approach is the need of the hour. So the Ministry of Ayush is focused on evolving integrated therapeutic approaches in the treatment of cancer, especially to reduce the side effects produced by radiation therapy, chemotherapy, and even problems after the surgery in the treatment of cancer by allopathy system medicine. Actually, a number of workshops were conducted at that time to evolve therapeutic approaches in Ayurveda, Siddha, Yunani, and even Yoga Naturopathy, Homeopathy also. As far as Siddha system is concerned, effective medicines are there, especially herbal, mineral, and mineral formulations. As pointed by Professor Dr. Jayaprakash Narayanan, my teacher, gold basma, Danga basma, the certain mercury preparations, they have been found to be very effective in the treatment of cancer. Regarding symptomatic treatment, along with allopathy drugs, allopathy treatment, radiation therapy or chemotherapy or even drugs. Certain symptoms can be treated by supplementing Siddha medicine. For example, pain, diarrhea, vomiting, itching, burning, ulcers, cough, sore throat or hoarseness of voice, headache, body ache, bloating, constipation, loss of appetite, weight loss. These are all symptoms associated with cancer, for which all of the drugs are prescribed, but in order to reduce the side effects, we can supplement Siddha medicines for all these symptoms. So that you can alleviate the symptoms in the patients, especially when the patients approaches at the terminal stage. Allopathy, of course, has a very great role in alleviating the pain, but in other, not only in pain, but also in other symptoms, Siddha also plays a very important role, as I indicated a number of symptoms. So when we supplement the Siddha medicine, it reduces the side effect produced with the allopathy system. And also the patient, it renders the patient comfortable to a greater extent. We have to go a long way in evolving integrated approach. As pointed out by my professor, Dr. Dept, Ayush has a definite role in the successful management of cancer. So I think today's meeting is an eye opener for evolving a number of approaches in the treatment of cancer. I hope the future deliberations will open a lot of avenues in the successful management of cancer. So once again, I thank you all for having given me an opportunity to have associated with me today in this meeting, and I hope I'll be able to contribute much in the future deliberations. So thank you very much for the opportunity given to me once again. Thank you.
Excellent, sir. Thank you very much. Really, in brief, you have covered all the aspects. Excellent, sir. Really very great. So now I would like to request Dr. Santosh Patil ji. Dr. Santosh Patil, kindly unmute yourself. He is Assistant Professor, Cancer Specialist, Department of Agadatantra, Consultant, Abhaya Cancer Center, Kahes Sri BMK Ayurvedic College, PG Studies and Research Center, BELAGAVI. Welcome, welcome, Dr. Santosh Patil. Now stage is yours.
Good evening, sir. Thank you so much for kind introduction. At the outset, I would like to thank the committee for inviting me, and at the same time, I would also extend my thanks to Dr. Suhas Kumar Shetty, sir, who has recommended me to present my experience to this platform. And considering me, thank you so much, Dr. Sharma, sir. I'll just begin my presentation. Sir, is the slide visible? So is the slide shared, sir?
Yes, sir. Yes, sir. Please continue.
Yes, sir. Yes, sir. Yes, sir. Thank you. Yes, sir. Yes. Thank you. Yes, sir. My journey in the cancer is very, what we can call, is of hardly 3 to 5 years. We had started an OPD of cancer in KLE Ayurveda College, that is Sri Beena M Ayurveda Mahavidyalaya, which is started in 1933 as a college, and now it's a super specialty hospital in Ayurveda. In that hospital, we run a Abhaya cancer care OPD for cancer patients especially, and it is in collaboration with IRES Ayush Cancer Clinic, Pune, which is run by Dr. Yogesh Bhandare, sir, a Shastra by Bisik. And then at the same time, we also have initiated a fellowship course in cancer for 2 years with an objective to develop a comprehensive care for cancer, provide evidence-based medicine, and enrich human resource for cancer care especially. So with that intention, we had started fellowship course also, where there are already 3 batches passed out. And then coming to my experiences in the cancers or different cancers. I'll be sharing them. As initially told by Dr. Bhargav sir, that in Ayurveda there is that even if at all there is little bit of nidana that happens to be remaining, then definitely it is going to fire back in a very bad sense. So these are two references why Ayurveda has a very important role in cancers. Like even if a little bit of hetu is there, and then like how Vayu takes again the fire into the highest mode. Similarly, even the smallest nidana in Ayurveda after post-surgery or post-chemotherapy or in disease-free survival or corrosion-free survival, Ayurveda with the help of Siddha Aushadhi, what they have told, Siddhartham. So especially the rasayanas, which could be Suvarna, Rajata, all bhasmas it may be there, or rasayanas including Bhargava Ukta Rasayan it may be there, Chavanprasha may be there, Brahma Rasayan may be there. So these are useful. So with this small understanding, we had started the OPD, and at the OPD, what we began to see is like, initially we had all the patients who come after chemotherapy or radiation therapy at almost the end stage, and their requirements were like pain, weakness, loss of sleep, fatigue, loss of appetite, nausea, vomiting, nutritional imbalance, going into cachexia conditions, swelling or edema. So these, and anxiety and depression. So with all these things, we started to understand how the cancer should be treated. And one more thing that had advantaged me was because I come from Agadatantra. In Agadatantra, there is a definition like, in Chikitsa, they tell that if at all the Vishay is in Amashaya or Pakvashaya, then definitely it produces symptoms like Murcha, Chardi, Atisara, Adman, Deha, Vepatu, Indriyanam cha Vaikrutyam, Kuryad, Amashagatam. Okay, these are all Amashaya and Pakvashigata Visha, where in chemotherapy, if it goes into the body, these kind of presentations are produced. So maybe Pakvashigata Visha Lakshanas could be related alike, little bit of that. So considering them, Visha conditions, so treating them with the help of anti-poisonous drugs, what was the intention to start it? So Suvarna being one among them. And then we had adopted certain principles to the treatment, like Matra Basti, Grita, as Bhargav sir was also telling, we use a lot of Grita instead of Taila, because Taila is again Ushna and could lead to Pitta Vruddhi. But Grita being again Pitta Shamana and Agni Vardhana. So different types of Grita like Kalyana, Kashwagandha, Shatavari Grita, Dadima Grita, all these Grita, we are using it into the Matra Basti and all. Pichu, Kavala, Gandusha. So we have started all these things. I just run through this because I want to discuss more about case. Sir had asked me to do that. I just come to the cases, sir. This is the status of cancer care at Ayurveda Hospital. We can see here, sir, since 2015 till now, we have new OPDs, like, up to 150 patients per year, and OPD running up to 500 to 400 patients every year. This is the IPD status, like in the left side where we can see, sir, 90 to 100 patients, we get IPD patients per year. So, and these are different cancers which we see across at our OPDs, like sarcomas, ovary, urinary bladder, hepatobiliary, C rectum. So these are all the things which we see in my journey. Coming to the first case, so this was a case of transitional cell carcinoma of urinary bladder. A 78 years old male. By profession, he was a veterinarian doctor. So he said that he doesn't like to undergo surgery or any kind of conditions, especially chemotherapy and all. So only he had underwent TURP, that is transurethral resection of prostate, that too because of forcefulness of the patient attenders, right? And then he presented to our OPD with frequent urination, urgency of maturation, body ache, myalgia, pedal edema, general weakness, fatigue, insomnia. These were all the things. And if you see the PET scan, we had an 1.1 centimeter bladder thickness with anterior wall and SUV being 11, which is comparatively more, and left posterior wall of the bladder being SUV 19. That indicates that it is aggressive in nature. And the surface of prostate are lost. So the difference between this cancer tissue and the prostate, there's a fat surface. That surface is lost. That means chances of spreading this cancer into next level is high. So on this patient, we started the medications like rasayana therapy, which is in the next slide. I'll show you all. So here what happened at baseline, this foul smell, frequent urinations, they were all there. And then we started a treatment for this age-old person with Hirak Rasayan 12.5 mg every day morning, Sutendra Rasayana, that is a little bit modified form of Suvarnasut Shekara, Somakalpa, that is classical preparation, then Chandraprabhavati, Gokshuradi Guru, Gokshur Churna, and Ashwagandha Churna. This entire thing was mixed and made a powder and asked to consume every day, 3 times a day after food. And then we can see here that after a certain time of a period, after 1 year, we can see here that is resolution of previously seen bladder wall thickening within 1 year. So you can see a study shows resolution of bladder lesion, and without any wall thickening, and no FDGV lesion is seen. So this is At 78 age, when the risk is high, chances of spreading are high, only with these medications we were able to control this person. So the treatment outcome was like, a volume of 1.1 centimeter and having chances to spread to across the bladder and then move into the abdominal cavity was resolved completely. Parameters before and after treatment, because we had given him basmas and all this hirak basma, suvarna shekhar and all, the parameters were pretty normal, nothing to worry. Like usually the Western people do say that after using basma there could be chances of variations in the liver and enzymes and kidney markers. So but nothing as such was found in this patient, and he was hale and healthy. Then in sign and symptoms, we can see here foul smell, urine, nothing was present. Insomnia, and his weight you can see here from 78 he moved into, it is 84, sorry for typographical error. His weight was gained. ECOG from 2 to 1. Quality of life score, sorry, the quality of life score was done by fact G, sir. So the fact G score from 78 it came up to 94, and weight you can see here from 64 to 66 kg. This is the treatment outcome. The discussion of this patient is that usually such patients of transitional cell cancer, they can go into as I said, into very bad mode. But this patient showed very good response within 6 months of Rasayan therapy, and this patient is still following up, and recent scan also shows there is no wall thickening. So since last 3 to 4 years, this patient is doing very good. With these medications, we have tapered down only Somakalpa, and only the powder is presently being given to the patient. We have tapered down Hiraka, Sutendra, everything. Coming to the next case, which we had seen, C8 tongue that is relapsed. Again, 38-year-old male person diagnosed as well-differentiated squamous cell carcinoma in 2016, for which he underwent modified radical neck dissection on 1/8/2016. Again, it relapsed in 2019, and as well-differentiated squamous cell carcinoma. He was advised 30 fractions of 60 centigrade of radiation and cisplatin in 5 cycles. So he underwent from 2019, here you can see from 5 to in 1 month, and he stopped in between because of the severe adverse effect after 4 cycles of what we can call cisplatin, and after 24, I think 24 fractions of radiation, he stopped it and then had come approached Ayurveda hospital, considering that whether there is anything about he can do. So on investigations, once he had come, and this is 2019, pardon me, a typographical error is there. So lesion of 4.5 into 4.1 into 3.1 centimeter at anterior midline and posterior third of left lateral tongue. That means the left side of the tongue was almost, still the lesion is present. And the primary objective of this person was that he should have progression-free survival. And so again, we started with Hirak Basma 12.5 mg, Malla Basma 12 mg, Sutendra, Sindur Bhushana, that is Kajili and Suvarna Basma, then GI powder, which contains Arogyavardhini and Agnitundi Vatirasa powder, combination of ours, Respin powder, that is combination of Talisari Churna and Lagusut Mishrana. In between, whenever he had a cough symptoms or respiratory symptoms, we used to use this Respin powder, and Tiktakagrita, as said. So Tiktagurta was given every day as a Shamananga Snehapana for him every day, considering it this Granthi, which is Meda Pradhana. So Tiktagurta is usually given whenever there is involvement of Meda and Vata. We usually give it. So this was given for him, and his pain had come down. His quality of life improved. So this is the, you can see that at July 2019, 4.1 into 4.1 into 3.1 centimeters there. And in October 2019, the lesion had reduced to 3.1 into 1.9 centimeters. So there was almost 50% of reduction in the cancer cell. Here you can see case of carcinoma of tongue since last 3 months. Patient was on we had given him somal therapy. So residual disease decreased in size and decreased. And then you can see here a recent 6/3/2020. We had sent him to the hospital where he had first undergoing radiation and chemotherapy. So visualized portion of the tongue does not reveal any obvious focal lesion on the present study. No evidence of lymphadenopathy, and neck shows appearance of normal, no residual disease. So within a span of 1.5 years, we can see that this lesion has totally come down. So the treatment outcomes as again difficulty in opening mouth, swallowing associated with excessive salivation, generalized weakness, burning sensation in mouth associated with constipation. Presently, no complaints are there. ECOG unable to take bath also. He was gone into that such kind of depression where he was not able to even bathe himself. Someone had to push him around. So from that he came to 0 with the ECOG value, and then from weight 47 to 50 kg, and he's presently doing his all farming agricultural works by himself. So usually what is the importance of this case is that usually this oral cancers recurrence varies from 18 to 76%, and the median recurrence period is 7 to 5 months. after the treatment, and 86% of recurrences occur within 24 months. So up till now, for at least from 19 to now, it's almost 2 years, he is disease free. And the presence of cervical lymph node metastasis is an important adverse prognostic factor in such cases. So extracapsular spread is particularly reliable predictive for loco-regional recurrence and distance metastasis from and death from the disease. So this person who could have nearing the death is presently living a normal life. This is one case. The another case is chronic lymphocytic leukemia. Like 44-year female had a complaints of eruptions over bilateral lower and upper limbs and face, facial edema, weakness, too much weakness. Like she was brought to a clinic after 5 to 10 minutes. She entered into my OPD. That kind of weakness, fatigue was there. Then disturbed sleep, bowel not satisfactory. She was put on a chemotherapy because considering it lymphocytic leukemia, rituximab and bendamustine. After taking 2 courses of this chemotherapy, she landed in having skin rashes and herpes, viscerpa, and she stopped the chemotherapy. And she was known case of hypothyroidism. So since 2 years. And then she also had mild dyspnea. This was her history. Once we asked her history, what are the presenting complaints, she said she had mild dyspnea initially and intermittent fever were there. For fever, she used to take paracetamol and painkillers. Okay, and then slowly she started with drowsiness, sleepiness during daytime and feeling cold, developed abdominal pain in left hypochondriac region, painkiller again taking for that. And then after that, once she consulted, it went into like, gross splenomegaly, mild ascites, multiple enlarged lymph nodes at mesentery and all, known as chronic lymphoproliferative disorder. So this patient gave us a complete picture, like, whenever a fever is there, jwara is there, if Deepan Pachan is not done, suddenly the fever is brought down. After bringing down the fever, she was having a duty sitting beside a court. She was a typewriter in a court. So she used to take medicine and eat whatever food she wants and then again continue. Like Punaravartaka Jwara Samprapti repeated in her. And if you see Punaravartaka Jwara, it leads to, the Rakta Dushti, and then leading, if it takes the Rakta Dushti, it takes towards a Pitta, then it may land in Rakta Pitta. And if it takes into Kapha Samprapti, then she will land in again Pandu. So this patient, though diagnosed with lymphocytic leukemia, she presented with all the complaints of Pandu as Punavartaka Jwara. Considering this, and even if you see Pandu or Raktavasrotas, then splenomegaly or Udara. For Udara also they have told, like, immediately after any Vyadi, if Apatya is done or Amla Padartha are taken, then it could lead to Udara. So that also had seen in this patient. So considering this Ayurveda so pretty good Samprapti, we had started the patient with medications, basically considering Pandu, Tiktarasa and Anushta Shitaraga for Kafahara, Agni Dipana, and this thing. So 1 second. ನನ್ನ ಪ್ರೆಸೆಂಟೇಷನ್ ಐತಿ 5 ಮಿನಿಟ್ ಒಂದು 10 ಮಿನಿಟ್ ಬಿಟ್ಟು ಹಾಕ್ತೀನಿ. ನನ್ನ ಪ್ರೆಸೆಂಟೇಷನ್ ಐತಿ ಒಂದು 10 ಮಿನಿಟ್ ಬಿಟ್ಟು ಹಾಕ್ತೀನಿ. ಪ್ರೆಸೆಂಟೇಷನ್ ಐತಿ 10 ಮಿನಿಟ್ ಬಿಟ್ಟು ಹಾಕ್ತೀನಿ. ಪ್ರೆಸೆಂಟೇಷನ್ ಐತಿ 10 ಮಿನಿಟ್ ಬಿಟ್ಟು ಹಾಕ್ತೀನಿ. Sorry for disturbance. So this lady, so we started with Pandu Hara Chikitsa, gave her Arogya Vardhini 125 mg because it is Anulomana, Pitta, Prasadana, then Sariva, Manjishta, Churna, Praval Panchamrita, mixture of this was given every day. And then along with that, Rakta Prasadana, we started with Hiraka Rasayana, then Dasma, that is Somnathi Tamra Basma, which is again used for Lekhana Karma, then Kame Rasayana, which included Suvarna Rajata Tamra Basma, then Suvarna Suchikara, then Suvarna Basma with Kajili, and Rasaka. There, especially in case of Pandu or whenever Agni is there in Grahani, they tell that Rasaka is good. So considering this and all, we had given this treatment only continuously. So what was the treatment outcome was that initially the spleen was 18.4 centimeters, then it slowly came up to 13.6 centimeters. Then there was regression of my multiple lymph nodes which were there. The next slide would be appropriate to show you. So here you can see, sir, this is before the treatment, 18.4 centimeter, the spleen was there. Later it came up to 13.6 centimeters. And these lymph nodes which were there like 8.4 to 4 centimeters, they slowly started to regress down, multiple lymph nodes. So, but though the disease remained, but still we can see that there is a reduction in the this patient almost pretty much followed up till 1 year to us. The spleen size had come up till 10 centimeters where we couldn't note it down. But later, as usual, these patients are usually, misguided, like you can take the treatment there. And also we missed this patient, but it had given very good results to us. So these are the blood values. Here you can see HB, which was 9 running down, came up to 11. And then here, normocytic normochromic anemia. So that means the cell formation of the cell was at least started to become very normal. So this was the achievement from these cases. This was how the patient presented to us, like facial edema, puffiness and all. later after 3 to 4 months of treatment. Here you can see how the edema and all the skin had come down, edema and all. Now, this is another case of Hodgkin's lymphoma. A 20-year-old female diagnosed as Hodgkin's lymphoma, nodular sclerosis in 2011, received 6+6 chemo. Then again in 2017, it relapsed Hodgkin's lymphoma, took again 6 chemos. In 18, again it relapsed, approached our OPD with often fever and cough, generalized weakness. And after 15 days of initiation of treatment, pain during, she had initially pain during swallowing, because there are images that I would like to show later. Because of huge swellings in the neck region, she was unable to eat normally. Odonophagia was there, but slowly later, because of the treatment, she started to eat normally. And the important thing is that this patient required multiple IPD for Sthanika Benga, because the patient was very adamant in taking medications. Like 1 month if she felt better, take, and then again will not come, again come whenever the problems were coming up. So such kind. So whenever she came, like respiratory problems were there, we gave Sthanika Benga to Ura Pradesha. And at a point it came like, this lady, even after taking our medications for 6 months, she landed up in having these, usually Hodgkin's lymphoma, they go into myelodepression, so where the HB started to fall off. And at the relative attenders called me to a hospital where she was admitted in ICU, where the HB was 4. And because of the vessels, like after receiving so many chemotherapies, the vessels would become very fragile. So what would happen down is that because of fragility, the blood transfusion was very tough. So that asked them to get blood transfused through the central line. And then the high risk patient was there, because it could load and death could happen. And they asked what we could do. So we started giving her Rakta Basti, like Ajar Rakta Basti, we gave her twice. So the patient responded very well to this. And the Jivaniya Gana, or the Guna of Rakta, what they tell, Prenana Jivana, that is attributed to Rakta. This patient from stretcher we brought to our hospital and gave Rakta Basti. And after 4 days, like after giving 2 Rakta Basti, the patient herself went to, bathroom to defecate and all. So what more we need, that our acharyas tell that such kind of explanations. So this is the confidence what we are gaining day by day after following the basics of Ayurveda. So here you can see this patient cycle, presently unable to more semi-solid food than solid foods, like can't take, and then fever on and off, and this was going on with the patient. So we have noted Tapyadi Loho Patal Dashmu Patuderi. Here you can see, now I change the slide, previous complaint of dysphagia, odonophagia has come down by 80%. So this patient went on till almost 2019. So here you can see, this is a patient's lymph nodes, what you can see. So these many weeks after giving the treatment, so this is the effect, like these nodes went on. Of course the nodes of the cervical and the mediastinal came down, but we were surprised because the what you can call the pelvic lesions were increased. So now this is the urdhvagata sharira and adogata, like pakwashaya, adogata vata and vat. So this is, I was unable to understand in my small experience, but these same Hiraka, Sutendra, Tamra Basma, Arpisa, these were the only basma which I had shown in previous slide were given to this lady, nothing other than that. But the Urdhva Jatrugata, all the Granthi and all became went off. But only in the pelvic cavity, the lymph nodes remained and the size remained same. So that was a concern for me, how and why these drug acted differently in the same patient. The same kind of patient where we see everyone cannot afford Hiraka Dasma and all. So what was the another condition? The same kind of patient, a male patient, but a same age, you can see 34, often fever, cough, again relapsed case. See here, high grade diffuse lymph from 2018. Post 3 chemo showed partial response, and post 9 cycles, no interval change in lesion size. Last April 2020, again relapsed, underwent 9 chemotherapy, itposide and ipsomide. All the 3 regimens were over, and advised next line of chemotherapy, high risk and poor prognosis. So he was told that there could be possibility of survival or no. And this patient had come with loss of appetite, on and off, and fever, weight loss, submandibular swellings and all. So here you can see, like, partial response to the treatment in 2018. These are all the lymph nodes that were there. And then in between the treatment, here you can see hypermetabolic adenoids, bilateral tonsils were there. This is all what we have documented. What we had given to this fellow was, we considered all this granthi and so much amount of toxins pumping into his body, and then on and off and fever. We again consider it as visha, and especially the mushika visha where granthi do come. So we did dipana pachana with panchkola phanta and shadang panya. And then once the jwara and vikruta kapha were addressed, like he started having appetite, jwara were stopped, then we started with snuhi navnita. We started to give him snuhi for nitya virechana for 4 to 5 days, and then gave him mallagruta 20 to 25 days, like 5 ml every day. discuss Mallagrutha side effects. I'll tell that what is that. And then we added Tamra Basma, Somnathi Tamra Basma, tablet Chandraprabha, Arogya Vardhini, Lakshmi Vilas, Naradiya. These were given randomly, like, whenever the different complaints came up, randomly these were given, nothing other than that. So initially couple had an issue, like, even we were surprised this patient had issue in between also, he could be get. So then they decided to terminate it. So this is the side effect what I wanted to tell. So initially what I did, like, we tried Shodhana of Malla, so Malla, and then we prepared Malla Grutha and gave. But I was not from Rashastra, so I was not sure whether it was purified or not. So first, what you can call IPD. So he started presenting these small lesions, which are known side effects of Malla, if it is Ashuddha. So we stopped that Grutha there and then started giving him Ashwagandha. And then again, we asked one of our friends from Rashastra to prepare the Malla, Ashodhita Malla, and then we prepared this Grutha by adding Brahmi Kashai. So then again, it has shown very good results. So these are the number of IPDs that this patient has gone through for Nitya Virechana with Snui. Every month we give him 3 to 4 days of Virechana with Snui and then followed by Grutha Malla. Okay, and this is the present report. So we can see that there is interval, though there is interval decrease, but the patient has not shown a simple sign of what we call, there are decreases in lymph nodes. Okay, some lymph nodes have decreased, especially only the mediastinal lymph node has increased in size, but rest all of them are status quo or some are reduced. So this patient has shown very good response, like, since 2019 until 2, so almost 2 years down the line, he's showing very good response and doing good without any fever. He's a driver by profession, so he drives every month, like, for this thing and all. CA bladder I have explained one, so this is the same case. I do not want to go ahead. And one more case that I would like to is CA brain, brain lesion. In June 2020, a male patient, 60-year-old, high-grade glioma with features of left parietal lobe, large neoplastic lesion, comorbidities such as hypertension and diabetic, complaint of weakness in right upper limb and right lower limb in past 15 days, unable to walk. He was brought on a wheelchair, slurred speech, unable to respond very fastly. The patient was admitted in hospital twice and various protocols were followed, which I'll show you all. On the basis of Ayurveda, we thought that this is Vata Kapha Pradhana disease, left about what is brain lesion and all, Mastishka and Majja, as Dusha affecting Pranava, Rasava and Raktava and Nirova Srotas. So what we did, we started this patient with, Kosh Shuddhi internally with Gandharvastadi Taila 40 ml, 100 ml of milk on this date. Then Matra Basti with Brat Saindavadi Taila, random alternate day with these are the dates completed when. Then we started Nirobasti. So we started Nirobasti with Varnadi Kashaya and Varnadi Guta itself. So Varnadi Kashaya, what we did, we added additional Bhalataka into it. We added almost 5 to 10 Bhalataka in an increasing order. So this gave very good result to us. And Nasya with Bilvadi Gulika and Stanya Dugdha. We have a IPD where the different deliveries happen every day. So we took advantage of that and we asked the mothers to give 1 spoon of Stanya, and then we rubbed Bilvadi Agada and then gave Nasya to it. I mean, these were not followed at a time, but step by step these were followed. And then while for discharge, we sent him with Dhanadanyadi Kashaya, Rasna Saptak Kashaya, Varnadi Kashaya. Again, we asked him to take internally, and Indriya Kalyana Rasa, that is Kumar Kalyana Rasa, which is told in Indriya Abhighata, and also we gave that Hiraka Rasayana and Dasma, again Tamra Basma. So these were followed. And for Jiva Nirlekana, we gave Kalyana Kavleha, later Vacha Churna and honey. And these were again Agni Lepa on affected site, physiotherapy. And then Patte, we gave coriander kashai because we were keeping him on Ballataka. So I did not wanted any side effects to be coming to this patient. So we gave him daily, little bit amount of coriander kashai, dhanya kashai. So that gave, in that way, the patient was very good, because otherwise Pitta Lakshana may come. So you can see here, sir, from 2 months, from 26/5 to 27, the higher mental functions, the patient was same. Expressive, slurred speech, not able to speak few sentences clearly, expressive, receptive, and both. He was able to talk, not able to understand commands immediately. He used to command. Then coordination became good. Nasofable, that is nasolabial fold, was not intact. Then it became intact. Clenching of teeth became intact. Sensory, like touch, pain, everyone were positive. Knee jerk, all these were diminished. They improved slowly within 2 months with this treatment. Kinesia, coordination tests improved a lot. Here you can see the strength from 3/5 to it came 4/5. Muscle tone came up to the normal. So these are the case paper of that patient, what we had given to this patient, corneal. So these are all examinations that we have done it or not to show you. So what was the discussion here was that I wanted to add, because I had done a mistake here. What was that mistake is that after doing Basti, we had kept the patient again, and after 15 days, we had done Upidaka Sneha to the patient by giving him 40 ml before food and 80 ml after the food in the afternoon. Okay, for the first time, the patient showed very good improvement. Like the patient started to walk with a stick by himself, who had come on a wheelchair. But what happened second time, what we did, the patient was like, can I take this Upidaka Sneha in a home? So we said, okay, you can take it. But the patient doesn't know what is Agni, what is Kala and all. Suddenly it all, whatever the 2.5 month we had done entered into a flop show, because again the avarna happened and the patient was again on wheelchair. So this is what happens if we do not follow our own basics, sometimes, what I learned. And after such an improvement, still the patient attenders, as I tell, there are so many people who misguide, go there, here and all, and because of that we lost the patient. He went into another practitioner. It's not a blame, but he was receiving, at least he was able to walk by himself, doing things by himself. But still a report which I have not put here, I've collected, but I couldn't put those reports here. The lesion size was same after 4 and 5 months also, but still they believed that there is no reduction in size and what is going on. The patient started to walk, but that was not seen to by them. Only the lesion size sometimes patients see. So whether it is good or bad, I don't know, but we lost this patient after we stopped our treatment. He expired after 4 or 5 months. If we had kept, this is also same patient, astrocytoma brain, we gave same kind of treatment. This patient who was unable to talk started able to talk bisyllable word, completely bedridden, body gone into what you can call like a rigor mortis kind of a condition, crying every day, at least night, because of pain and all. We gave him Shadang Paniya, Sudarshan Ganavati, you can see here, Gokshuradi Gugulu, nothing more than that, only plain, following Agni Deepana Pachana Srota Avroda, removing. See here again Shalipani Prushnapani, the Angamarda Prashamana, because he was crying, we were able. Then Eranda Taila. So all these were given to him, all basic things, Varunadi Grita Shadang Paniya, Badradarvadi Kashaya, because stiffness was there. Considering it as Vata Pradhana, we gave Badradarvadi Kashaya with Varunadi Gruta. So this patient slowly started to improve, responding for commands, who was bedridden for more than 1.5 years, started to respond to commands, talk a little bit. These were good. So these were few cases which I wanted to explain. So not want to take much time. Hello.
We can hear you,
Sir.
Santosh.
Going excellent, going excellent.
Sir, I thought like only 20 minutes was allotted, so I'm done with my time with 5 cases.
Okay, great, but excellent practical explanation and inspiration for all cancer specialists in Ayurveda, as I hope. All the best, doctor. So all the best. Please go ahead much, with your all expectations from Ayurveda, because that is ocean of treasures.
Yes, sir.
Our Ayurveda is ocean of treasure. Ayush, rather I can say.
Yes,
Siddha also, Unani also. Excellent, excellent.
Thank you, sir.
Now, I would like to kindly stop sharing your presentation. So I can present the presentation video of Dr. Beena MD. Dr. Beena is leader of Department of Kayachikitsa, JSS, Ayurveda Medical College. Thank you, Dr. Sudhakar Reddy ji, for introducing Dr. Beena ji. Thank you very much.
Thank you, sir.
Thank you, sir. We are traveling train, sir.
No problem. We are here with you.
Thank you, sir. Thank you very much, sir.
Santoshi, if you stop sharing your screen, then we will be.
HOD Department of PG Studies in Kayachikitsa would like to share my clinical experience in palliative care of cancer patients. And once again, I would like to thank Dr. Pawan Kr Sharma ji for this wonderful platform for sharing my experiences. I would like to brief. Cancer is the most dreadful, grave, and tissue-invasive disease which gradually hampers the quality of life and causes the decreased life expectancy. And as per the experts, pioneers, and various researchers in Ayurveda, correlate cancer with different disease conditions like Arbuda, Gulma, and Asadhya conditions like Shatajakasa, Hridoshaja Ashas, Yakrutodara, and so on. Cancer, why so panic? Cancer is one among the second leading cause of death worldwide. But cardiovascular diseases are first leading cause of death worldwide. Still, cancer plays a dominant role in the human life because of its unpredictable, vicious, that is very cruel, and having fear about its proximity, fear of relapse of the disease even after taking the established modern cancer treatment. At present, the available allopathic treatments for cancer are complex, unpleasant for the patients and relatives, as it requires long period of time with risk of relapse. Also, there is no significant or effective management of terminally ill patients in reducing the sufferings or improving the quality of life. And coming to the therapy of cancer, or the conventional therapy or the modern therapy, what they are doing. Also, there are many side effects with chemo and radiotherapy: nausea, vomiting, diarrhea, bone marrow suppression, hair loss, poor quality of life, etc. So by with this background, by seeing all these conditions, when I was doing my PG studies, I have taken a study on the topic management of Arbuda with special reference to cancer and observation study. So 2006 to 2009. So that was my journey of treating cancer patients, especially the palliative care. So this was made to evaluate the combined effect of Brahat Gulma Kalana Rasa, Kanchanara Gugulu, Varnadi Kashaya, Madhusnahi Rasayana, Amalaki and Amrita Churna internally. So whenever we think why this much big combination has been taken or multiple drugs have been taken means, we know very well that whenever the cancer patients approach us, so they will be with multiple sufferings or multiple, the system will be involved in their sufferings. So we cannot take only one or two medications here. So we have to manage the condition here. That is why Brahat Gulma Kalandasa, Kanchanara Gugulu, Varnadi Kashaya, especially they have mentioned like it is Arbuda Hara, Granthi Hara, or Gulma Hara, Chosha Hara, Yakrutodara, Plihodara likewise. And Madhusnahi Rasayana, Amalaki and Amrita Churna internally. So here the study also was taken as it is an anti-cancerous property of Amalaki and Amrita Churna taken from many studies. So in my case, I have taken 22 patients, and out of that 14 patients of stage 4 cancer was taken, excluding the dropouts. And these 14 patients were assigned into single group. The patients were given the study treatment for the duration of 6 months. And the assessment criteria, the general condition was measured by using a performance status Karnofsky scale, documentation of the pain in terms of the severity, measurement of weight in kilogram, and symptoms were graded in order of severity. And accordingly, in 15 days and 2 months, the radiological as well as the subjective parameters were measured accordingly. So why I'm telling these things means, whenever we do any of the treatment, it is also very important to document all the things, because it should be an evidence-based, at least to tell the other fraternities of our own the medical field. And the results were very much encouraging, and the study treatment has shown efficacy in relieving the signs and symptoms of majority of the patients. That is 12 patients out of 14 patients were having very good relief in the signs and symptoms, and while only 2 patients were not responded to the treatment. 12 patients showed improvement in performance status, that is the general condition was noted very good in the Karnofsky scale, and in 3 patients the tumor size not grown further during the treatment. Out of 14 patients, 3 patients showed possible survival benefit compared to the expected median survival as per the extent of the disease. That means the 3 patients were having very good lifespan or the life expectancy. So here I would like to mention only one case. There is a case of rhabdomyosarcoma stage 4, having the a very big tumor, abdominal hard mass. It was measuring about 3 to 4 kgs in the USG abdomen, and it was metastasis to the lungs, and the patient was with a very huge edema into the right lower limb, having other symptoms like dyspnea, cough, mild loss of appetite, and all those things. And the same study medications was given in this patient. The very important thing here was the prognosis of the patient was said to be very poor, with a short life expectancy of about 2 to 3 months. That's according to the expert oncologist. But the patient received the study treatment for 1 year and 8 months, and the performance status was very improved, very good in the initial stages, and later towards the end of his life it was reduced to 20. That is, the general condition was reduced to some extent. And the very interesting thing was the USG abdomen, which was measuring about 8.5 to 4 kgs, the abdominal mass. Later, even after this 1 year 8 months also, or the 1 year 6 months, the USG abdomen, there was no change in the size of the the abdominal tumor, because it has not increased. So that is a very the encouraging result in this particular case. And on observation, the results, it can be said that the treatment in this case would able to increase the life expectancy to a great extent, along with moderately improved quality of life, and also help in preventing the further growth of the tumor. So after this, treating these many patients, or coming across with these many patients, then I also felt some changes is needed in treating these in patients. So wherein we know that the keeping rasayanas in almost every grave diseases, especially in cancer also. So whenever we see that in the classics, it is mentioned by our acharyas that whenever we give these rasayanas, they should be initiated, means initially we should do the shodhana. So here also I have taken that concept, and I thought, even though it is a stage 4 cancer patients, even though they may not be having very much bala, still a mild form of shodhana will be always helpful, and followed by when we give our rasayana therapies or the anti-tumor treatment, it will be helpful. So on that basis, I have taken a second project that was started in 2020 and completed last December 2021. I have taken 14 patients, and the research title is an open-label single-arm clinical study to assess the effect of Sadhya Virechana along with the Shivagutika in the subjects of stage 4 cancer. So this result was, again, it is very much encouraging, and here the patient could able to tolerate the medications little more, in a very good manner, so that the quality of life also was comparatively, compared to my previous study, it was seemed to be improved. And the intervention was 3 days of Sadhya Virechana with the Gandharva Hastadi Erenda Taila, along with fresh Gomutra or Gomutra Artha in appropriate dosage after assessing the koshta of the patient. Also the bala of the patient, because we have to always think of the dosage. So if they are very mild and all, only maybe 5 ml of Gandharvastadi Erenda Taila can be given, or any other. So this was the Gandharvastadi Erenda Taila was taken by me for this study, or that is not very mandatory that only Gandharvastadi we have to take, or any other such anulomana drugs we can take initially for a Mradu Virechana or an anulomana. And on 5th day onwards, the Shivagutika tablet, that is weighing about 1 gram PAD for 3 months, was given to the patients, and other symptomatic care as per the condition, because we know very well that these patients are coming to us with a lot of sufferings with the multiple system involved. So according to their signs and symptoms, we may have to ready with some of the medications when and where it is required. So I have taken some classical preparations from the this thing, wherein like the different symptoms like nausea and vomiting, like Madhipala Rasayana, that is taste, loss of appetite, and pain abdomen, Hingvashtaka Churna, Pipali Churna, or Yavakshara, etc., and bloating of the abdomen, like Hingvachadi Vati, or diarrhea, Dadimastaka Churna, Kutaja Ganavati, etc. And similarly, like constipation, indigestion, or whatever the different conditions, from the classical medicine, I have taken some of the drugs, and whenever where it is required, I used to give them accordingly. And even the patient also, like whenever we give our classical, the medications, like for example, if at all they comes with udara, like hepatocellular carcinoma, end up with the cirrhosis of liver, and they will be coming with a huge abdomen, like very much pulse in the abdomen, and totally the ascitic, the complete ascites will be developed in those patients when really they have got such a very wonderful result after having come to a hospital and treated with the classical medications like this. But the common drug what I kept is Shivagutika. Along with that, symptomatic treatment was given. And other relaxing procedures even we can give like Shirodhara, Sarvanga or Ekanga Abhyanga or Kashaya Seka Lepa whenever it is required. For example, if the patient is having chest pain because whenever they have the bronchogenic carcinoma, so they will be having a chest pain along with that cough, a lot of sputum collection inside. So there we can even use like the Brahat Saindavadi Taila or Nirgundi Taila for external application and Nadi Sweda. So that also will have a lot of relief in them. That is what we can do in this palliative care. And other drugs like Ashwagandha Churna, Amrita Churna, Amlaki Churna, Gomutrartha. So whatever we need accordingly, we can use here. Okay. So the results were the symptomatic relief has been seen in 12 patients out of 14. And the life expectancy out of 14 patients, 2 patients have showed very good life expectancy. And tumor regression has shown in 1 patient. And out of 14 patients, 3 patients are still alive and on Ayurvedic medication. They will be coming for the regular follow-up and they even after the 2 years of the study. And so here also one case I would like to explain. A person who was having 75 years with a bronchogenic carcinoma and having a lot of the severe cough, expectoration, exertional dyspnea, pain, right side of the chest and all those things. And he was diagnosed with the right upper lobe with the secondary deposits, like upper lobe tumor with secondary deposits, and not given any specific medication from the modern medical side because they have, according to them, the opinion is that the chance of survival would not be more than 2 months. So we have started the treatment. At the starting of the treatment, means they have come with a report like neoplastic lesion, right upper lobe with the secondary deposits. So we have started the study treatment as well as I started this Mrudu Virechana. The patient could able to take 2 to 3 Mrudu Virechana and as well as 1 classical Virechana. So even Snehapana with Gugula Tiktakulta and Dantakari Krita was given for 7 days and later Virechana with Trivrit Leha. And the Dashamula Katatraya Kashaya Shivakutika Shwasa Kutara Rasa Kanchanara Gugula was given to the patient. And even he was having multiple cervical lymph nodes like noted or very hard swellings over the both the side of his neck. And the patient has got very good symptomatic relief. And even after this, the very wonderful, the interesting part was like the repeat CT thorax, wherein it has mentioned that compared to previous study dated on 13/9/2019, present study shows marginal reduction in the size of the lesion. So of course, this is a very, even though the patient is in stage 4, still we could able to, reduce the size of the tumor also. And more importantly, he was clinically or what you can call the general improvement in the patient was very good. Until the end, the patient was survived up to 7 or 8 months later, but till the end, he was comfortable. He had a very, a very good end of his life. So that is what we could able to make there. So the role of Ayurveda in treating cancer is like improve the quality of life and quantity of life also, and prevent or minimize the side effects of chemo and radiotherapy. Management of the sequel, the complications we can manage to a greater extent and prolong or prevent the recurrence of the condition whenever. So this is very important because even whenever they go to the modern hospital, whenever if their first stage or second stage, third stage, so they will have this modern treatment and they will be coming for the follow-up with their radiations, radiological examinations or blood tests, etc. So that time, once they get discharged from their hospital at complete chemo and radiotherapy, we can take them for the maybe a Shodhana, a Mradu Shodhana, or according to their Bhala, we can decide what type of Shodhana you can give it. Accordingly, we can select the medications also, and they will have a very good result. So the recurrence can be prevented to a greater extent, and regression of tumor and metastasis also. And so there are here. So by seeing all those things, what I was understand was like we should have some goals in the cancer treatments. Especially we have to keep these goals very, very important. to promote patient's treatment schedule. So this is very, very important. And because each and every patient, when see, it will be a different case. Even though it may be a hepatocellular carcinoma, patient to patient it differs. So we should promote the patient's treatment schedule and maximize care quality. So this is also very, very important because cancer means it kills. The name kills. It is not that exactly. Many times the cancer kills, but the name kills because it is the stigma is like that, or the fear for cancer is like that, as I was telling in the first slide. So similarly, we have to give little counseling to the patient. We should be patient with them. We have to explain. We have to spend time with them and maintain the palliative care and to guide end-of-life arrangements. This is very, very crucial for the patients of cancer because many times from the hospital, they will be rejected. And most of the hospital, they will not take them because financially, they will not get, the hospitals will not be benefited, or even they cannot be managed properly at home. That is also very much painful for the patient's relatives. So in that time, we should really help them a lot how to arrange or how to end the end of the life, how we should take care of them. So here are some patients we used to, because we have the cancer clinics in our Jesus hospital, and we treat many patients. And this is how we will go there and we take care of them. We will speak to them for some extent, and we can see the smile on their face. So this was a case that the lady with 88 years with the basal cell carcinoma of the skull came with the maggots. The maggots was, I think, some nearly about 50 to 70 maggots were removed, and it was very, very carefully removed. And the wound, you can see in the picture that after that she had a proper follow-up, and it was the wound was completely healed. And how she will be getting smile on her face, or how they are grateful to when we do the minimum services. So this kind of things we have to improvise in our hospitals, or even we have to show to our own students, and they should cultivate these type of attitudes so that it will be the burden, especially in the end stage patients, will be very much helpful to reduce the burden. It is very much helpful. And so out of all these things, what I understood, or in palliative care, important our other treatment principles will be a vata nigraha, pitta shamana, and kapha shodhana. So whenever you do these things according to your patient's condition or the bala you have, so very important is assessment of the bala of the patient. So kapha shodhana we tell. So but shodhana also you have to see how much the patient's bala is there, because even sometimes what happens with 10 ml of Gandharva patients, I have seen a very recently one patient had 7 to 8 times loose dose. So that's why assessment of the koshta is very, very important. And after that, so if at all some complications happens, we should be ready for the management of those things. So finally, that is like the Rasayana and Balya, along with that, the Agni, that is the Dhatva Dipana or the Agni Dipana treatment that should be given, or Pachaka and Shrota Shodhana line of treatment is very, very important, because we know the Shrotas or the Shrota Avarodha will be there in these conditions. And our main aim is, because we have to understand one thing is, always whenever we think of rasayanas, we may also have a doubt that whenever we give these rasayanas to a cancer patient, even the cancer cell also can grow. But there is a small difference there, and we know that even according to the classics also, the rasayanas can be uptaken by only a normal cell. So then there is the benefit here. So we have to improve the normal cells in our body. So it's that our normal cells should be oxygenated very well. So that is why this particular shodhana will be helpful for them. So after the shodhana, when we give this rasayanas, the normal cells can uptake this particular rasayanas very well, and so that they will be, become more stronger, so that they fight against this cancer cells. So that is what the reason, the principle behind it. And the scope of rasayana, as I was telling, it will be, we can consider it in a 3 different manner, like the preventive aspect, or once it is manifested, and but to reduce the side effects. A preventive aspect we can see in the form of like the primordial or primary prevention. Primordial prevention, why means, for example, if somebody is having a positive family history, like maybe a breast cancer, definitely we will be known with the studies and other things that the breast cancer patients, many of the times it will be like hereditary. So in such conditions, we can give an awareness to those people. So we have to give this awareness to the people, and accordingly we have to tell. So whenever it is a particular cancer we identify in their family, we can give a particular rasayanas. So before giving the rasayanas, definitely we have to go for the shodhana. So even exposed to the risk factors, there are few people, maybe they are working in the industrial level and all those things, or some mines, etc. Then we know now what are the risk factors. Accordingly, we can give the regular shodhana to the patient and give the followed by the rasayanas. And if at all there is no history of cancer, the positive factor exposure, etc. In such conditions, that means we may expose or we may not expose. We don't know exactly, and there is no history of family history, etc. Still, we can also undergo the shodhana. That is why our Acharya very clearly mentioned about the Rutu shodhana, and later take the general rasayanas. And once the particular disease is manifested, then according to the condition of the different types of the disease or the system involved, we can give the Naimitika rasayanas to the patient, or as per the system involved, we can select the different rasayanas. And the important part, especially Ayurveda can hold a very good place, is the minimizing the side effects of chemo and radiotherapy, or even to give the other anti-carcinogenic drug, whatever is here. So like in the Ayurvedic science, because there are so many research works are going on in this particular field, and we see most of the articles published in that manner also. So we can select those medications, or we will be through such seminars and all, we will be knowing many of other drugs. So those drugs can be used here after a proper shodhana. And coming to the towards the end of my presentation, the integration is very, very important, because so we always have to think of the benefit of the patient. So whenever you are really thinking of the benefit of the patient, we all systems, like maybe it is a conventional system, Ayurveda or any other Ayurveda systems, all should come together to give a maximum benefit to the patient. So especially in cancer also, because many a times we see patients with first stage or second stage, third stage. Of course, we will not touch them, because we don't know, we may not be having a standard protocol or established protocol to treat first, second, third stage of cancer. So at least what we can do is, after treating by them, for the to reduce or minimize the recurrence of the disease, we may have to take a very greater role in that. Or even the palliative care, they don't have much, apart from the painkillers, they don't have much thing to do in the palliative care. So that particular part we will be looking after. So all these things, why this is all because for the benefit of the patient. So when all the systems like what you can call the modern cancer therapy with Ayurveda or any other Ayurveda systems will combine together, we were really giving a best benefit to the patient. So development of strategy for the prevention of cancer, and to contribute in improving quality of life, to establish a supportive therapy facilitating to reducing side effects of cancer chemo and radiation, improving the immunity, improving tolerance and compliance to cancer therapy, and integrating for hoisting cancer research. So, and challenges, of course, every particular step we will be having challenges, like interdisciplinary studies have to be taken, next level evidence to be collected, and collaborations with the national and international level, and publications of the data. And always what I'm thinking is like every hospital, especially an Ayurvedic hospital, also should have an integrative oncology, wherein the hospital should have a regular oncology consultant, physician, that is from the modern side, and from Ayurveda, Kayachikitsa department, Shalya department, and from the department of Swasthavrata and Yoga. So there should be a combination of these departments along with other departments integration depending upon the type of cancer. And always emergency care trained nursing staff to manage those emergencies, and separate cancer OPD or ward for palliative care, referral systems as per the MOUs, and documentation of the data. Documentation of the of data and research and publication is very, very important. And coming to the conclusion, Ayurveda can help cancer prevention. Ayurvedic rasayanas, panchakarma, and yoga and other interventions help in cancer regression and symptomatic relief. Is also very well be managed by our Ayurvedic line of treatment. Reduce side effects of cancer therapy and improves immunity of the patient and improves overall quality of life of the patient. So once again, thank you very much, Pawan Kr Sharma ji, for this wonderful opportunity to talk and to.
Thank you, madam. Salute to you and Sudhakar Reddy ji. You are traveling, then also you contributed for the society. This is a miraculous deal. Really, I appreciate your deal. Thank you very much. Now, yes, please, some question is there from Dr. Ramesh Rajguru, I hope. Yes, please, kindly ask.
No, sir, no questions, please.
Okay, thank you.
It's a very nice presentation. I have no question at all. Yeah.
Thank you. Now I would like to hand over the stage to Professor Madan Thangvelu, sir. Sir is the best moderator guide for me. So I would like to learn from sir. Welcome, sir.
Pawanji, pranam. Thank you so much for another amazing event today. Yesterday we had one event, day before yesterday we have, and tomorrow we have another one, which is even more exciting. So number one, congrats to you on your 3 centuries here. So namaskar.
To us, sir, to all of us, sir. Congratulations to all of us, sir.
Number two, before I go on to make a few comments, I want to thank all our senior colleagues here. And I particularly want to thank Sudhakar Reddy ji today for introducing, Suhash Shetty, who's not with us, for introducing a wonderful speaker, which was packed with information. And our senior colleagues like Agadatantra ji and Doma ji, and so many others who are here with us. So thank you for giving us all your encouragement and support to keep this activity alive and with increasing content and quality. Now, starting with today's first presentation from the world of Siddha medicine. Jaya Prakash ji, thank you so much. On our previous interactions, we asked about case studies, and you have given us the case studies today. And you have also introduced us to the many formulations that are available and that you have used. And so we are very, very grateful to you for taking us into the depths of what is available in the Siddha world, the work that is going on, and the work that needs to be achieved. At this point, I just want to highlight that in the chat box, I have put some details about the European Union's sitting here in Europe, and the European Union's cancer mission, which is a very, very important mission. I have put in the chat box details about ongoing discussion between CCRAS and the Government of India with the National Institute of Health, the National Cancer Institute in Bethesda, and some work that is going on there. In some of my previous presentations, I have shown provided references to use of Brahmarasayana in management in some experimental models. That is work done at the military university, the Walter Reed Center in America. So there are many details that are going on outside the country, but somehow they are not aware of the quantum and the quality of work that is happening in India. And today's presentation brings those details out from the Siddha world, work that is going on in Madhya Pradesh, in a very old institution that Bhargavji has given us and taken us into, the work that is going on in other institutions in the country. Particularly, I want to thank the work from Beena ji. Beena ji, I have put some, Sudhakar ji and Beena ji, I have put some information in the chat box. You have highlighted today the importance of some details, like, let me just pull up my message here. There are details that you have given here about Koshta Shodhana. And this is so important because this comes up again and again in our discussions. When we talked earlier, 2 days ago on Brahmi Vati, and we had a chance to just come into this point again about the importance of the Mahashrota. And you have emphasized a very nice point here, Koshtashodhana, and also Sadhya Virechana. Now, my question here is, can these kind of small, relatively harmless techniques, but with the potential of greatly improving the absorption of perhaps your treatment modality, can this be harmonized and standardized to be used as a part of any cancer care, not only Ayurveda, Siddha, but also going into integrative care? I was happy to, I sent this message before I saw your last slide, Dr. Beena. So I'm happy to see that you are highlighting, you are pointing to better, perhaps looking into these aspects. I particularly liked your slide where you're showing how to develop a team of people in integrative cancer care. All these details are missing in our dialogues here about cancer in the European Union, missing in the dialogues in cancer at the National Cancer Institute in America. So thanks to yourself, Dr. Beena, for highlighting these points today. And I hope in future discussions here in Europe and in America, we can bring out many of these points and get more input and contributions from yourself. I feel today's presentation has been a landmark in terms of contribution to understanding what is happening in the community for cancer care. And I'm sure there is much more happening. I'm aware of the weekly cancer clinic that is held in Kottagal. There is every Thursday, I gather, there is a cancer clinic that happens at the prestigious Ayurveda in Kottagal. I have put in the chat box work that is going on in Vagoli. It's about 20 kilometers from Pune. Maybe many of our friends already know of this institution, the Vagoli Integrated Cancer Center. It is recognized by the Department of Ayush, the Ministry of Ayush, as the Integrated Cancer Treatment and Research Center. Is recognized as a center, as an excellence, a center of excellence, and it's a recognized center for PhD studies since 1984 with the University of Pune. So there are many, many things that are going on in the country, but somehow we are not aware of each other's work, and we haven't brought it all together. So for me, today's event is very special because it has brought together some people who are not heard outside the small community. So I want to thank all our senior colleagues for introducing speakers. I want to particularly thank Santosh Patil. Santosh's presentation was what I call a high energy presentation. It is like a masterclass for anybody interested in Ayurveda cancer treatment. It is not for the faint-hearted. That means if you don't understand the finest details and intricacies of Ayurveda, including his specialty. So he is right in saying that he specializes in Agadatantra, the toxicology aspects of Ayurveda, and he turns it around to appreciate how Rasastra can be used and how you can. So this is the depth at which Ayurveda has to be shown to the world, how we understand the deepest principles of life. So Santosh ji, I know you are not here with us. I hope we will get a chance to reconnect. I wish your presentation to be slightly refined and taken to Europe, taken to America, taken to other parts of the world to show people the depth and the clarity and the mastery that one can have in Ayurveda, the kind of treatment modalities that are available, and the confidence that you have used to really catch hold of the patient. You really are concerned about the patient. You really connect with the patient. The same with Beena ji. You connect with the patient. You really want to help the patient, and you put your heart and soul into that treatment, and you bring out the best of all the Ayurvedic formulations. Beena ji, I want to say, I enjoyed very much one table that you presented with all the treatments that you have, all the modalities that are available, all the conditions. Now that is so comprehensive. I wish people at the world's best cancer research centers to start to see this and to appreciate what Ayurveda can offer. So this is my take on today's presentation. Pawan ji, thank you so much for bringing
Jaya
so
Prakash Narayan ji भी हम लोगों को बहुत गाइड किए सर.
हाँ जी. So first of all,
Jaya Prakash Narayan ji,
Jaya Prakash ji, and you have brought senior people, Professor Ramaswamy from Chennai. We look forward to all of you people for more contributions. I am from the two presentations in particular, from Santosh's presentation, Beena ji's presentation. I just want to highlight that you have taken us with such confidence into the depth of cancer care. You have told us how cancer begins, how you can manage, what are the symptoms, etc. And that input that we had from Jaya Prakash ji, from the Siddha side, I feel if we come together again, there is so much more we can offer, not only immediate treatment, but also to take this message about treatment modalities and the thinking about human physiology in health and disease to the rest of the world. Before I finish, Pawanji, I just want to put one note here, which is for all of us. Jaya Prakash ji mentioned about the Adyar Cancer Center. It is one of the oldest cancer centers in India. And I suppose Jaya Prakash ji knows about the history of that center, set up by the first lady MD, if I understand correctly. And then which has become the Women's Institute of Adyar Cancer Center, a very, very prestigious place. The new director there who has taken over the center is very, very keen on other modalities for treatment. And he wants to set up a big division there, a big department for other modalities. So there are many people who can guide us, help us in the future. And with all the senior minds, Ramaswamy ji, Jaya Prakash ji, Rumba Sandosham, thank you so much for being here with us till the very end. And all the other people, thank you so much. It has been an amazing day. I will be pointing many of our colleagues here in Europe and America to the presentations today to visit them, to see the confidence with which Ayurveda and Siddha is being used in daily practice. The last point I want to say, Vagoli in Pune, the cancer center, the Integrated Cancer Research Center, Ayurveda, they now have over 16,000 documented cases where Ayurveda and integrative approaches have been used. And the senior people there, Dr. Arvind Kulkarni and Sardesh Mukji, I hope we can all come together, to form a collective that will again benchmark the needs for future thinking about integrative medicine, use of Ayush, Siddha, integration of Ayush, Siddha, homeopathy, and Unani systems into our cancer care for the future. Pawanji, I have enjoyed every minute of today's presentation. Thank you so much. I leave it with you because I know 9 o'clock you have to have your dinner. Otherwise, you are. So that is a good benchmark for when we draw. I'm sorry, Dr. Baswati ji is not here with us. Baswati ji is our liaison person with the National Cancer Institute, with the American National Institute of Health Cancer Program. But I have sent her details saying there are some excellent presentations here and we need to revisit it.
Thank you.
Namaskar.
I am observing Dr. Mahajaveen has joined us. Dr. Mahajaveen is from Delhi and she is from Unani Research. I would like to request Dr. Mahajaveen, because when Ayush discussion is there, why you can be missed? Dr. Mahajaveen, do you want to say something on cancer? Yes, you are unmuted, but your voice is not coming. She is trying to connect, but her voice is not coming. So I would like to request all the dignitaries of the dais, if any suggestion, addition, question, curiosity, whatever is there, please feel free. It is your platform, no time limits, so we can discuss with experts. Narayanan ji is with us, Ramaswamy ji is with us, Beena ji with us, Akhlesh ji has left, but various experts, all experts are here. If anybody want to discuss anything.
पवन जी शायद एक डॉक्टर नीलाक्षी जी है हमारे साथ. नीलाक्षी जी, नीलाक्षी जी आपसे भी थोड़ा सुने जी, थोड़ा अगर आप.
आज इतनी अच्छे प्रेजेंटेशन हुए सर, किसी का कोई क्वेश्चन ही बाकी नहीं रहा.
इतनी जबरदस्त डिटेल्स, इतनी आपकी पवन जी, आपकी रसशास्त्र वाले और अग्रतंत्र वाले, they are doing phenomenal things. Thank you so much for bringing so much information today to this event.
Hello.
Nilakshi ji, namaskar ji.
Hello, sir. Am I audible?
We can hear you very clearly. Thank you so much.
Thank you, Madan sir. I'm Dr. Nilakshi Dev Chaudhary. I have been listening to the topic very well, and it is indeed a very good experience from all the speakers and their way of handling cancer by improving the physiology of the human body. How to improve the physiology? By removing the toxicity, by improving the enzyme level, the status of Agni, deepen Pachan, and doing Virachan by expelling the toxins. When the toxins are expelled from the body, the tissues the cells, the tissues, the dhatus, they get enriched. And when they are clean, they can absorb the food materials, they can absorb the medicines, and the patient increases the immune status and he can fight cancer. And when this concept was described, and all the speakers, they showed very good drugs, be it Rasayan, be it what you say, cancer, tumor, regressing properties. So, and many times these drugs, we are, in fact, I'm very scared. Okay, will it have any toxicity? But it's very nice that the speakers showed that showed that they have minimum toxic levels, and even if they show toxicity, they mention the appropriate drugs for controlling the toxicity. And sir, thank you so much. You have given us so much scope regarding research, regarding clinical works done in works and abroad and India. Sir, thank you so much.
Nilakshi ji, please, before you go away, please tell us where you are located today and what is your specialty. I think we would all like to know a little more about yourself, please.
Sir, I'm working in Government Ayurvedic College, Guwahati, Assam, and my specialization is Samhita. Basic principles, Samhita department. And before I joined Ayurvedic College, I worked for around 10 years as medical officers in different districts, in 5 districts of Assam.
We feel we are very privileged to have you with us, Nilakshi ji. I hope you will join this activity and guide us for the future, please.
Okay, sir. Thank you so much. And sir, I also have an extra training in Panchkarma from CRI Cheruthuruthy.
Oh, very nice. We don't have our other Samhita expert here is Dr. Ramadas from Kerala. He's not here with us today, but we want people like yourselves from the Samhita side, from the Sanskritam side, to help us correct our mistakes, because we keep making so many mistakes as we go along, and we need people like you to stop us and make us think yesterday. Yesterday, Ramadas ji was very quick when I made a mistake by saying that there is a general thinking that when we look at dravyas, ahara dravya, aushadhi dravya, that ahara dravya is predominantly sitting in the rasa aspect, the rasa domains, and the 4 other aspects of the panchaka, rasa panchaka, are the attributes of Aushadhi Dravya. And I quickly, as soon as I finished the webinar, I had a long voice message from Ramadas ji saying that thinking is incorrect. We have to think about everything.
Ramadas ji is with us, sir.
Oh, Ramadas ji is here with us. Ramadas ji, namaskaram. So we want guidance from senior people like yourself who are dedicated to the Samhitas, who can tell us where to find the answers and how to interpret and reinterpret some of the deep ideas. So thank you for being with us. We want the same help, the Samhita help that is coming for Ayurveda. We want the same help from the Siddha community also, because they also have a very rich literature, but their literature is all in Tamil, which makes it impossible for us to understand because, you know, it's a very small group, it's a very specialized group. So it is a request to Professor Ramaswamy and also to Jayaprakash ji to bring to us people from the Tamil Samhita side, which I don't know what you call it, from the Tamil texts, to guide us in thinking about integration between Siddha Ayurveda and where we can actually develop something superior that no other country in the world will be able to touch. So Ramaswamiji,
Dr. Mayank Verma is asking something, sir.
Ramaswamiji, unmute, please. You are muted. And then we take
yes,
Mayank Verma ji. We can't hear. Ramaswamiji, you are muted.
Yeah, can you hear me?
We can hear you, sir.
Yes.
Thank you.
Yeah, hello everyone. I think I'm surprised that Ayurveda is also doing so much about cancer, which is not awareness in the society. So my name is Mayank Verma. I am 39-year-old and living in Gurgaon, Haryana. I was diagnosed for CA colon in 2019 and had a total protocolectomy surgery. After that, recently it got relapsed. So it is nearby surrounding only, but it is stage 4 metastatic colon cancer. So what I wanted to understand is, so there is one problem with me that my weight is very low. So after taking 3 chemotherapy, I cannot go further. So that is the problem with me, that limitation of the traditional medicine. So I put off chemotherapy away or trying to find out some alternative therapies. So I'm on complete raw diet as of now to heal myself, my body heal myself. I wanted to understand which are good Ayurvedic colleges in India where I can start Ayurvedic treatment immediately.
Mayankji, I'm going to answer this very quickly because you have seen Dr. Beena's results, that is JSS Ayurveda College in Bangalore.
Mm-hmm.
So the details you can either email or telephone Pavanji or one of us, and we will provide you the details. The other comment I wish to make here, Mayankji, is to please connect with Dr. Jayaprakash Narayanji. If you were with us during the talk, you can see the details are in the talk, but if you cannot locate it, please contact. I will put my telephone number here. Also, please connect with Dr. Beena and Sudhakar Reddy ji in JSS Ayurveda College. You can see from the presentations today the kind of comprehensiveness they are offering, the kind of complete understanding and the way in which they are tackling the most difficult of diseases known to mankind for forever, and how it is being revisioned and solutions are being offered. So Mayankji, please put your telephone number on the chat box if you are able to, and
sure.
Then put it, if you put your telephone number on the chat box and also a mobile telephone number, then, sorry, a WhatsApp number or something and the email address, then somebody will take care and come back to you.
Sure.
Thank you for, as a cancer patient, thank you for being here with us, listening to us and coming up and presenting your need. This is what is needed for the future. We need more engagement, patient engagement, and you have presented your need so clearly. So thank you for doing that. Mayanki. I wish to invite Dr. Professor Ramaswamy ji. I think he's unmuted now. Sir,
Yes,
we
yes,
want
yes.
to hear that question about the Samhita side in Siddha. And when we look at even the TKDL, the traditional digital knowledge library, Siddha formulations are slightly underrepresented there in TKDL.
Yes.
And we have a lot of Unani formulations, a lot of Ayurveda formulations, but the Siddha formulations are a little underrepresented. We want to see where the difficulty is and how to overcome this difficulty, sir.
But the problem was, formerly it was in Delhi. So our Siddha graduates were not willing to go over there and work. Now the work is being carried out in Chennai itself. So in near future, you can expect more from Siddha side.
Sir, I have a question for yourself and Jayaprakash ji. Can you give me names of one or two Siddha doctors who are also fluent in Sanskrit?
Pardon?
Would you be able to identify among your junior staff members, Siddha staff members who are fluent in both Tamil and Sanskrit?
Tamil and Sanskrit, we have to find out.
It's a difficult. You see, it's a big challenge. It is a big challenge.
We will get this answer on 21st, sir, because
21st.
On that day, International Mother Language Day is there.
Oh, beautiful.
And we have given our topic, Sanskrit, the language of all mothers.
All
So 11 Sanskrit experts will guide us regarding Ayurveda and Sanskrit.
The point I'm making, Professor Ramaswamy, is the bridge between the Siddha Ayurveda systems is still very shaky. And I feel there is a huge amount of synergy if we bring the two systems together. And for that, we need young people, younger students.
We can find out.
Thank you, sir.
Of course, it's challenging affair, but it's a need of the hour, and we'll find out.
We will. And Jayaprakash ji brought for our on one of our Mercury meetings, he brought a young researcher, young professor. Jayaprakash ji will remember his name is Dr. Ganesh, I think, and he's a young professor in Chennai at the Siddha. And his presentation on Mercury and the understanding of Mercury in Siddha systems, it is so enriching because it is different from how Rasa Shastra understands Mercury. There are some subtle differences, and those small windows take us into a whole new world about how you make your preparations. You see, your Siddha preparations, your Siddha Mercury preparations are very, very important and very, very exciting. And there is a big tradition there, which we would like to, the world would like to know a little more about this.
Of course, we will
we look forward to senior people like yourself for guidance. This is the important thing, that Pawanji is holding a platform, and we want to bring all of you people into this platform. So, Pawanji, before I finish, a request to Dr. Sriramji, who's here with us, whether he can give us a few words now. I will leave it with you, Pawanji. Sriramji is listening to us very carefully. I don't know if Sriramji, namaskar ji, pranam ji. अगर आपकी तरफ से कुछ हो हमारे लिए।
श्रीराम जी ने एक फॉर्मूला हिंदी में लिख के भेजा है सर, चैट बॉक्स में।
अच्छा जी।
ही इज एक्सपर्ट फ्रॉम दैट। और रामदास जी भी जुड़ चुके हैं।
रामदास जी नमस्कार सर। Thank you.
Yes. Only one promise from my side. The Siddha people who does not know Sanskrit, if they are really interested, tell Ramaswamy sir to make some 10 students of first year or second year. If they want weekly 1 hour or 2 hour classes for learning Sanskrit, I can support them for learning Sanskrit.
Great, excellent.
Ramdas ji, from my side, I have one other, now that you have joined us today, thank you so much for being here with us. I'm happy that you are here because I took your name when Dr. Nilakshi ji was talking about our Samhita.
I heard, sir.
You heard that.
Yes, sir.
Now, my question for Ramdasji is, in our Kerala tradition, we have that famous document Sahasra Yoga.
Yes, sir.
And I don't think Siddha people know it. I don't think our North Indian colleagues know about Sahasra Yoga. And this is another area where I have seen our friend Dr. Manoj Kumar, who's one of our government Ayurveda officers. He has been successfully treating liver cancer patients with some formulations that are found only in Sahasra Yoga. So there are things that are happening in the country, and sometimes using local knowledge. Sahasra Yoga is very special because the content is purely based on our Kerala herbs and herbal formulations. Now, that kind of interaction cannot be had in Europe or in America because they don't even know what is Ayurveda, let alone Sahasra Yoga or the specializations like Siddha and all these things. So we are in a very strong position globally in making some developments for the future that can provide us global leadership in this space. And I feel this collective effort is the only way ahead, because for us it is challenging to understand Tamil. For people who know the Tamil literature, it is difficult to understand the Sanskritam. And if we hold hands and we stay together, I think we will be a very, very strong force and unique force globally. So I'm grateful to Ramdasji for all your guidance, for your fine analysis of some ideas, the Panjabhutik thinking about these aspects. I'm deeply grateful for your help. Pawanji?
So now I would like to request Dr. B.K. Agnihotri sir for his concluding remarks. Professor V.K. Agnihotri sir.
Thank you, Dr. Pawan Sharma sir. And
welcome sir.
And my regards to all the senior and respected persons like Professor Madan sir, Professor Jaya Prakash ji, Professor B.P. Sharma sahab, our Ramaswamy sahab, Akhlesh Bhargava ji, our Jagdishwar Roma ji, and my friend Mr. C.C. Shukla ji, Professor Anil Shukla ji, Professor Sudhakar Reddy, and Professor Beena Reddy also. First of all, I would like to congratulate you on reaching 300th webinar, and this proves that you are succeeding to achieve the aims and objectives for what you have started this webinar, to come together all the pathies of Ayush and to assimilate the knowledge which is there in every pathy. So this is very good station where we reached all today. First of all, I would like to congratulate all the speakers, those who have filled full this webinar with the knowledge. Our first speaker were Professor Jayaprakash ji, and he talked about the data regarding the present scenario of the spreading of cancer. But he put one very important sentence which I would like to comment upon afterwards, that we all are spiritual scientists. One sentence which I caught it, and I would just give some point on it, because I am very keen and very pinpointed to listen everybody which has been attracted by the such renowned persons and working in this field. He put forward the Siddha approach over the cancer patients with all the gold preparations and their reals. But on the second person, who were our Dr. Akhlesh Bhargava, we all know that he's doing a lot in the field of the cancer, and he has gained name and fame both. So he very speedily informed all the work he is proceeding further, and he has completed with the help of the Ayurvedic preparations. And he underlined a few things like use of tulsi, haldi, aran, sadavahar, gomutra, nariyal pani, swarna bhasma, hirak bhasma, and so and the vegetables coming from the soil. So this is a very good topic. But I, though he is not, I think, at present, but I would like to refer one question which has been put by our young chap, our Dr. Santosh Patil, that when he was treating a case of tracheal region nodes and this cervical nodes, they got reduced out of his treatment, but the pelvic region nodes were enlarged or increased. So he may better answer on this question that was in my mind, that and if at all it is so, whether any sort of basti with all the things they are doing would be possible. But as Dr. Bhargava is full-fledged doing work a lot, I would like to put one question from my side to Dr. Santosh Patil, whether that area geographically is so prone to have so many patients, cancer patients, or they are importing the patients from different sectors of our country. There may be some reason, but the etiological factor is very important. If at all that habitat is there, responding as one of the etiological reason. He with the Shatabdi Express speed put forward lot of say experiences. Though he told that he was having only 3 years experience, but his experience is very much. So I do hope and I wish that he should go on and on. He was putting with a lot of preparations. And Dr. Beena, as our Madan sir repeatedly appreciated, she did a lot of work in the institutional patients with all her approach. So it was very good. But what I can say, one very important thing, as I started with the words that the spiritual scientist, though this platform is always accepting the things which are evidence based, but since it is my mind, I would like to share to this platform that there used to have a Shani Dasha, and that Shani Dasha falls on every 19 years or so. So a patient who crosses his first 19 years, then he may be having 38 years age, and then 57 years of age, and then 76. If and because in one's life only 3 Shani Dasha takes place, so in that way, if 76 years of age is being crossed, then he will not suffer from any sort of cancer. It is expected, and this is the astrological approach, because I've got experience for that I lost our younger brother-in-law at their late 50s. He was not reached 50s, and he was suffering from small cell cancer. So apart from chemotherapy, radiotherapy, and all the therapies, and whatever is being referred by any person of any therapy, we also contacted to an astrologer, and in that way he said something in this connection. So it may also be escalated by the researchers or the person who are working on the cancer patient, that what is the Shani Dasha is running with this in that patient. Because it is said that the cancer cells are always there in everybody's body, and they get activated on every 19 years of age repeatedly. This is one thing very important. So the treatment of cancer of any pathy can also be associated with some of the Shanti karma of Shani Graha. So it may be accelerate the management and the comfortable life to the patient suffering from cancer. This is one thing very important, and for that the whatever the remedy they say about the charity of or donation of this mash, urad, sabut urad, and black things or things of iron, whatever the favorable for the Shani. So this is one thing very important, can be studied on these lines also. So the persons, those who are working on this field and having a lot of patients of breast cancer, colon cancer, pancreas cancer, whatsoever, this is a thirst area where some work can be done. So overall, today's was a very sound session with the cancer remedies, and Mr. Manoj, who came forward with their his own problem attracted the real role of Ayurveda and Siddha, as we are, our doctors are working a lot. So he will be given, I think, with our experts, some of the treatment which will suffice his purpose. And he is fed up by modern medicine treatment, as he has got therapies also. So overall, this is a good webinar, and I congratulate all the speakers who have given a lot of knowledge over this platform. Thank you, everyone, and over to Dr. Pawan Sharma, sir.
मदन जी के पहले एक बार आशीर्वाद ले लूं आदरणीय जयप्रकाश सर का। कल फिर हम लोग मिलने वाले हैं, तो मैं उनसे आग्रह करता हूं
It is a well-organized seminar, and the whole traditional community is indebted to the moderator and organizer, my beloved Sharma ji, and the participation of Madan is very much appreciated. And I failed to hear fully the deliberation of Dr. Agnikotri, because I am also very much interested in medical astrology. The basic science for Ayurveda and Siddha are first astrology. Yeah, Siddha physician, Ayurveda physician is first a spiritualist, then only a physician. So I request our moderator, Dr. Sharma ji, to organize a separate session for medical astrology, where I also can participate.
Thank you, sir.
And I thank everyone, and I congratulate everyone for their active participation in an important session.
Thank you, really, thank you very much, sir. We are conducting
and my special thanks are to you.
Ji, sir. Thank you, sir. Thank you very much. Please join us tomorrow also. Tomorrow is gala program, big program. And we have invited our all dignitaries of Ayush for unity. Unity is the necessity of Ayush, where we can unite and show the world that what strength we have. Welcome.
We must unite and totally persuade our Prime Minister ji.
Yes. आदरणीय मदन जी से आग्रह करूंगा वो समापन।
Thank you
sir, thank you, आशीर्वाद देते रहिए सर आप।
बिल्कुल जी। तो पवन जी, आपके जो ताकत और आपके जो, पता नहीं हिंदी में क्या, हमारी हिंदी तो थोड़ा वो कमजोर है, मगर व्हाट आई वांट टू से, आपके जो ताकत और आपके जो सिंगल पॉइंट फोकस, हम तो जयप्रकाश नारायण जी, sometimes when my sleep is disturbed, I wake up at 1 o'clock and Pavanji is there. Before I go to sleep, he is waking up in India. When I am awake, he is already there, and he is generating program after program after program. So I think we need to honor Pavanji on this special event. 3 centuries, Pavanji. We are all grateful to you for making a home for all of us. You are like a parent that is holding all of us together. So we are grateful to you, number one, on this 300th annual seminar. It is an amazing feat. And
thank you, Ambassador. You are our ambassador for West and East.
Your blessings are my honor, sir. Your blessings are my honor.
We look forward to all the senior people here to bring out even more of what you are doing every day, and the even deeper insights that is there in the textbooks, in the commentaries, in the tikas. There is so much knowledge that is there. So I hope this dialogue will continue. And as Pavanji takes us into the 301st and onwards towards the 400th web seminar, as we proceed, I feel we are becoming closer and closer, like a very, very closely knit family, able to share our ideas, our thoughts, and to accept guidance and feedback from everybody. So, Pawanji, this special thanks is to you for your wonderful captainship of holding us
Thank you.
together. That is the best thing I can say,
thank
Captain.
you.
You are captaining a very, very important effort. I noticed we had one contribution, Pawanji, we had one comment from Dr. From Delhi, Dr. Majabeen ji, and she put a comment here, I treat lung cancer, I use green bryophyllum. It gives good results along with other herbal compound formulations. I don't know if Majabeen ji is here with us. So there are things that are happening in the Unani area also. And final
If Majabeen ji is listening our talks, please unmute your mic.
Majabeen ji, namaskar, pranam ji, namaste ji, adab.
In Ayush, you are missing.
आप कहाँ हो? आपका दिखाई नहीं दे रहा है इसमें लिस्ट में. आप कहाँ हो जी?
जी मैं हैदराबाद से हूँ सर.
नमस्कार.
जी नमस्कार. आदाब. आवाज आ रही?
हाँ जी आ रहा आवाज आ रहा.
जी.
थोड़ा बताओ जी ये ब्रायोफिल्म के बारे में आप कैसे प्रयोग करते हो उसको?
सर इसका जूस इसको ग्राइंड करके हम दूसरे मेडिसिन जैसे कि गोगल है, गोगल का एक फॉर्मूला है कचनार गोगल, वो देते हैं. और हम है तो कि एक मैं एंटीवायरल एंटी फंगल करके एक कैप्सूल बनाई है, उसमें पूरे ऑल ब्लड प्योरीफायर्स डाली भी हूँ मैं पूरे. और तीसरा जो है सर मैं ये ब्रायोफिल्म का कच्चा पत्ता पेशेंट को भेज देती हूँ. ऑल ओवर इंडिया मेरे से पेशेंट लेते हैं. तो लाइक 2 टीस्पून जूस 3 टाइम्स लेने को कहती हूँ मैं. और इस जो पेशेंट को बहुत ज्यादा खून निकल रहा था, यानी लंग कैंसर में खून ऊज आउट होता ना, तो वो विद इन 2 to 3 डेज में सबसाइड हो गया वो. और जो है कि गोगल गिलोई का इस्तेमाल ज्यादा करी हूँ सर. कच्चा गिलो यानी फ्रेश गिलो एंड फ्रेश ब्रायोफिल्म, इससे बहुत अच्छा इफेक्ट मिला है मुझे.
हमें थोड़ा और सिखाना जी इसके बारे में, शायद आएंगे एक तो अगले प्रोग्राम में. थोड़ा सा और बताना जी इसके बारे में. और
रेफरेंस इसका क्या है? यूनानी में रेफरेंस है इसका ब्रायोफिल्म का?
हाँ जी, इसको पत्थर चट्टा करते हैं हम लोग. इसको पूरा इसका बहुत अच्छा यूज है सर इसका. यूनानी में कैंसर में भी यूज करते हैं हम. और मैं फर्स्ट टाइम लंग कैंसर में इस्तेमाल करी हूँ और अच्छा इफेक्ट आया सर इसका. ये एक्चुअली पत्थर चट्टा का जो प्लांट है, इसका जो है वो स्टोन्स जो रहते हैं ना, किडनी स्टोन, उसके लिए भी यूज करते हैं.
I wish Majabeen ji, I wish you had थोड़ा और, I wish you had given us 1 or 2 case studies. शायद पवन जी ऑर्गेनाइज करेंगे आगे थोड़ा इसके बारे में कि
जरूर
सर जैसा कि ये जो वात रोग बोलते हैं हम लोग, सौदावी अमराज बोलते हैं यूनानी में, और ये आयुर्वेद में वात रोग बोलते हैं. इसमें जो कैंसर के केस को मैं ऐसे सामने से स्टडी करी हूँ सर. उसके जो बाल है, सर के बाल या बॉडी के बाल जो भी है कैंसर के केस के, वो जो है ना कि चेंजेस होते. जब मैं दवा देती हूँ उसका बाल का कलर ब्लैक हो जाता है. अगर वो दवा नहीं खाएगा तो उसका बाल का कलर वाइट हो जा रहा था. जैसे बात रोग में बताते हैं कि देर विल बी ए कलर चेंज.
मुझे जी हमारे साथ कभी कभी आते हैं यूनिस मुंशी जी, तो एक बार हाँ जी एक बार थोड़ा एलाबोरेट डिस्कशन.
यूनुस मुंशी जी ने ही मेजविन जी को रिकमेंड किया था.
तो थोड़ा और थोड़ा डिस्कस करेंगे जी इसकी।
जी सर।
जो
सभी को शुभ रात्रि।
जी जी।
Good night. Thank you very much for joining.
जी।
Tomorrow we will be meeting again with a gala program, like big program. Professor Madanji will be moderating. Professor Agnihotri ji will be valedictory session. So everybody will be a dignitary there tomorrow from one association. Thank you, sir.
नमस्कार, शुभ रात्रि, नमस्कार।
थैंक यू, शुभ रात्रि।